Good morning, Christy. Good morning, Patty.
Good morning, Cheryl.
Hi, Cheryl.
Good morning.
Cheryl, I won't be able to see the attendees until it gets started, right? And then I can check out who's all on.
Christy, you can open up the people panel in the upper right corner.
Oh, okay. I was just gonna see if Jill made it on. She has to call in instead of go through Teams, so.
Okay.
Oh, it would help if I unmute to talk.
We're the only ones on right now, right? Besides President Van Horn.
Correct.
Okay, well, I figured out what was happening with the Outlook calendar, you guys. It's really odd, but when somebody other than me forwards to their personal email accounts, and then I go into the live event, I have to actually make them a presenter because only me, the organizer, automatically gives them a presenter status. So all those emails kept going out because I would have to go in for those people that forwarded it to their personal accounts.
Who did you make as a presenter? Was it their NDUS account or their personal account?
Well, I had to do their personal account because they kept, there's a few of them that forwarded, even though we asked them not to do it, but they've done it.
Well, if they forwarded that, the link is still the same. That doesn't change.
Right, but in the Teams invite, I have to go in there and make them a presenter. Their status is unknown until I present them.
But if they have an NDUS, let's say that you invited them using their NDUS account, they forwarded that email message to their personal account, it's still the link is still for their NDUS account.
No, they're outside people.
Right, but if they're using an NDUS account and that's what you invited them on, when they click on that link, they have to log in with the NDUS credentials because that's what that account is, regardless of where they forward it.
But they're not NDUS people. They're TIA. They're from the retirement place. Vern Dosh from nd.gov.
Okay, so who are they forwarding it to then? So if you're just adding them as a non-NDUS account, what do you mean by them? What do you mean by they're forwarding it to their personal account then?
Like a Gmail account, but we'll talk about it after this meeting.
Sure.
Hey, Christy.
Hi, Jill, you made it on.
Oh, yeah. Okay, great. I just wanted to be sure audio was connecting. Thank you.
Yes, you're at the 507 number, correct?
That's me. Yep.
Okay, just making sure.
Yep.
Hey, Jill, just a heads up, you're not muted.
Gotcha. Thanks, Christy.
You bet.
And Christy, you should be able to unmute people or to mute people as well.
Right, but then I can't unmute them and they wouldn't know that I muted them, would they? I can't get them.
They can see that their microphone is turned off.
Okay, well.
Good morning.
Good morning.
Good morning, Casey.
How are you doing?
Well, I am fine here in Tioga. I'm going to check something.
Can you see me now?
There, I can see you. I think I have to switch my cameras. I'm on a different camera than I thought. I'm going to do a little IT figuring here, so I will be right back.
How's Kathy? Staying
Kathy is
busy?
doing good. We're good. We have the there's just not much drilling. Production is coming back. Wells are being turned back on. We're over 1 million barrels a day again. But the drilling side will not happen for quite a while. We're down to 10 rigs, I think. How about you? How's Grand Forks?
I think good. You know, it's mostly work, and I think things are going in a good way in Grand Forks County with COVID, but that's only 1 or 2 testing days away from not being good. So it's out there. It's not going to go away, but we're doing really well as far as numbers and haven't had much in a big way in the hospital, which is good.
That is good news. I heed your words. You said way back in wherever it was, June or something, when we were together, Casey. So just know that you made an impact on me.
Well, good. And I don't think we have to wear a mask for this meeting.
I don't think. Oh, jeepers! All my friends.
But if people want to and they'll feel more comfortable, they can wear a mask. But I do my social distancing. I do get out a fair bit, but I know where to stay away from things. So right now, the big issue where you're going to get it would be weddings, funerals, bars, and hanging around anyone under age 30, maybe even under age 40. So
Really? Okay.
that's, in a nutshell, that's the easiest way to not get it.
Well, then I think we heed your advice again and be careful. Well, I'm going to double check one of my settings here, and I will go on mute for a second.
No problem.
Good morning. This is Nick.
Hi, Nick. Casey.
Hi.
Good to
you,
see
Casey.
you.
You too.
Looking good. Hi, Josh.
Well, we're
got a big crew here. Hi, Danita.
How are you?
Greetings.
Hey, Dean. Lots of people. Hey, Doug. There's Terry.
Good morning, all.
Good morning.
Good morning, everyone. This is Jill. I am on speaking on the phone today. I won't be on the video.
Good morning, Jill.
Morning, Jill. This is Casey. I like the book you gave us.
Great. That's great. The next book I'll be sharing is How to Survive a 14-Day Quarantine.
Uh-oh.
And your last chapter will be How I Didn't Survive.
How I didn't. I finally crumbled. Yes. So I'll share this before the meeting. So Monday morning, I tested positive. Yeah. So when you talk about, Casey, the who's and where's and how we try to move at least the youth of our state forward, it's pretty tough, not to interact with those young people. And our county, in the last 2 days, we are seeing an explosion in the numbers of cases here. It's kind of interesting because we started our school year with a very conservative approach in terms of mandatory masks, distancing, segregating groups, and we can only do so much as a system to work towards maintaining our health, right, and our opportunity to be in person. But when it takes off, it really goes. So we've had a tough week here.
What county are you in?
We are in Eddy County.
Okay. I'll look at that. Thank you.
Well, take care, Jill, and stay strong and be healthy.
Yeah, thank you.
Yeah. Retha is having some trouble logging in, but she is on as a guest. So she's with us, but she will not be able to speak up. She is trying to get some help to get logged on as a regular member of the live Teams event. So she's with us, and hopefully we'll be able to join the more interactive version of the Teams Live. So welcome to the September 24th regular board meeting. As you saw from an email earlier, we're looking to reschedule the retreat. And really, we didn't want to put a date on that quite yet. And the reason being is we're really trying to track and monitor the current situation with COVID-19. And I know we all wished to be in person here today. And unfortunately, we had to make the decision in consultation with the task force and Josh Wynn that it might be best for us to continue a virtual meeting at this time. And so for our next meetings until we kind of see things trend in the right direction for a continued period of time, we'll unfortunately have to probably stay fairly virtual. And I do hope to see everybody in person soon. I've had enough of these virtual meetings personally, but we do have the work of the people to do in this and to take care of students in our institutions. So with that, I'm going to open the meeting. Christy, would you call the roll?
Board Chair Hacker,
Here.
Dr. Ryan,
Here.
Miss Nesset,
Here.
Miss Bai, Miss Bai.
Here.
Let's see. Okay. Miss Solberg,
Here.
Mr. Mahalik, Dr. Louder,
Here.
Miss Mattern, Dr. Lejersky,
Here.
okay, Chancellor Hagerat.
Here.
Okay, and we you guys can see in the participant list, we have several system office staff logged in also. BSC,
Here. I'm here.
DSU,
Hi, Steve Easton here.
Lake Region,
Good morning, Doug Darling here.
Mayville,
Good morning, Brian Van Horn here.
Minot,
Good morning, Christy, it's Steve.
DCB,
Good morning, Jerry Migler here.
NDSCS,
Good morning, everyone. This is John.
NDSU,
Good morning, Chrissy. Dean Bertrana here.
UND,
Good morning, Andy Armacross.
Valley City,
Good morning, Al LaFave here.
Williston,
Good morning, John Miller here.
okay, Eric Olson. How about Dr. Wynn?
Good morning, Josh Wynn. Good morning, everyone.
Mr. Dosh? Okay, thank you.
Great, thank you, Christy. Board members, the first item on the agenda is the agenda, item number 1. Are there any additions or changes that need to be requested to the agenda? And if not, we would be looking for a motion.
Chair Hacker, this is Casey. I would move approval of the agenda as presented.
Second, Member Solberg.
Great, thank you, Casey and Erica. Christy, if you would call the roll.
Miss Bai,
Yes.
Dr. Ryan,
Yes.
Dr. Louders,
Yes.
Miss Nesset,
Yes.
Mr. Mahalik, have you joined? Miss Solberg,
Yes.
Board Chair Hacker,
Yes. Thank you. Then the next item on our agenda is our consent items. and any board member, voting and non-voting, can request any of these items to be pulled off of consent and moved to the regular board business. I would just mention it appears there's really good work in here done by the Budget and Finance Committee, and the Audit Committee has a nice plan in front of it for the year ahead. We don't need to get into the details of these items. We're looking for a motion to approve of the consent items.
Chair Hacker, this is Nesset. I move approval of the consent agenda.
Chair Hacker, this is Casey. I'd second that motion.
Great, thank you. There's a motion and a second. Christy, if you would call the roll.
Dr. Ryan,
Yes.
Ms. Nesset,
Yes.
Dr. Louders,
Yes.
Ms. Bai,
Yes.
Ms. Solberg,
Yes.
Board Chair Hacker.
Yes. Thank you. That motion passes, and that will bring us to the update on the NDUS Smart Restart Task Force. I'm not certain that the title is still valid, Dr. Nguyen, but we'll keep working this task force. It may be the NDUS Smart Maintain Openness Task Force, but appreciate your work and the work of Mr. Dosh. This has really been a wonderful team effort in consultation with every institution and other experts outside of those institutions. And so you guys have been critical in our ability to deliver education as efficiently and appropriately as possible to help students learn. Josh, do you want to give us an update on some of the activities here?
Yeah, certainly, Chair Hacker, Chancellor Hagerott, members, presidents, guests. It's a pleasure to be here with you this morning. I don't know if Mr. Dosh will be joining, but let me just give you a little overview of where we are. And I would go back to where Chair Hacker started, which is the two words that are critical, both smart and restart. Let me just start with the restart and emphasize how important our students and faculty feel that a face-to-face interaction is. And let me give you personal examples. So in an effort to stay connected with our students, I've been calling individual students as well as student groups, classes and so forth, and just visiting with them, just chatting with them to try to feel more connected with them. And there are two themes that come back. One is they appreciate all the efforts that all of us have been making, but also they reiterate how important a face-to-face component is. Now, let me mention, it's just a component. Most of us do hybrid education and have been doing it for years. That is, there's an online component to many courses, and the students are fine with that. But they really emphasize the importance of the person-to-person contact that is part of the educational experience. So the restart part is important. And the smart part is important. I'm going to shortly share some of the data with you to show you that there are both challenges, but also some successes. And actually, maybe let me go to that right now. And I'd like to thank Carol Redmond for helping prepare these data. Hopefully, can you see that? Yes. Okay, so here, as of yesterday, are the active case counts and the monitored counts. And you can see it by institution. Now, of course, the numbers have to be interpreted in light of the size of the campus and so forth. And that's often complicated because sometimes students are only on campus part-time and so forth. But you can see that although it varies, no campus has been completely immune, but the numbers vary. If I go to this slide, and again, thanks, Carol, for preparing this, this shows, as of yesterday, the number of active cases reported by institution. up at the top, I don't think my pointer will work. Up at the top, you see actually UND. So you can see that early on after reopening, there were a lot of active cases. And then by aggressive testing and aggressive contact tracing, you can see that those numbers have gone down fairly substantially. The next curve is NDSU, and you can see that NDSU started off much better, but then climbed up some, but then, like UND, has done a really good job of bringing it down. You can see Minot next in green that went up and is now coming down. So I think this says that we know what to do to try to keep the restart going, but it's going to take effort. Here are the active cases without the two research institutions. So you can see that there are some institutions that are really quite low, others that have had some bumps. The gray is Dickinson, where a couple of weeks ago there was a bump and now they're coming down very nicely. So I think overall the trends are pretty good. Here's a slide that breaks it down by institution over time and normalized as best as we can for on-campus enrollment. So now we're comparing apples to apples, pardon me, and you can see that really for all the institutions, the trends are pretty good. You can see, though, that for the two research institutions, although both of them have come down from their respective peaks, with UND being higher, there's now a little bit of a seemingly of a plateau. Again, limited numbers. So the takeaway that we've taken from this is that we know the things that can help. We need to continue to do them. And if anything, we need to do them better. So the three takeaways that we have from this, and we're going to be discussing all of these at our task force this afternoon, are number one, how can we increase even further student testing? Number two, how can all of the institutions do a good job in their community, helping to educate the community as to the importance of the things that we know that work? And three, are there other things that we can do that can help what we're already doing to try to give us a warning when there's going to be an uptick? And in this regard, one of the things that we are interested in is actually a project where NDSU has taken the lead, and it's to examine wastewater from various communities and in fact even dorms to see if the wastewater analysis can give us a distant early warning of what may be going on in that region. I don't want to share those data with you. Let me just say that the early data are encouraging that we may be able to identify a potential outbreak of COVID by an analysis of wastewater. So we're looking into expanding those analyses to see if they can help us target testing to become even more effective. So in summary, Chair Hacker, I think the task force would be reasonably pleased with these results. I think that we've seen that it is possible to deal with this challenge, but I think it also is clear that if we let our guard down, that bad things can happen. So it's stay the course, but if anything, intensify the course as we continue to do this. Careful surveillance for potential outbreaks is critical. I think you saw the way UND, and I'm not doing this to be self-serving, but UND had a problem and appears to be dealing with it. I think that's a potential lesson for all the campuses to be ready to be both proactive and reactive, depending upon what's going on. The proactive part could well include this wastewater analysis if it really pans out as it appears to, that will help us target testing and contain potential outbreaks. So I think at that point, I will pause and entertain any questions. Thank you.
Josh, this is Casey. Have the students that have been quarantined, have they been good at spreading how much fun it is to be quarantined? Because that's one of your best measures for maintaining control of the problem.
Yeah, so thanks, Member Ryan. Two comments. One, I think involving students in proselytizing for doing the right things is essential, but at the same time, we are seeing some COVID fatigue on the part of students. So early on, the cooperation of students, according to the Department of Health and the contact tracers, was close to 100%. And it's fallen off some now. So I think one of the things we're going to be discussing with the task force this afternoon is how do we reinforce the importance of the things we're doing. I much prefer a carrot to a stick approach, but one of the things that we've emphasized is the people who are going to determine whether the campus remains open are not President Brashani and President Shirley and so forth. It'll be the students in large measure. They're the ones who will determine what happens. And I think the more we can get them to understand that sense of ownership, the better chance we have. The presidents are really going to react to the situation on the ground in their community, but that in large measure is going to be determined by the behavior of the community. So getting community engagement on campus and surrounding the campus, I think is essential. So yes, we are trying to engage the students as much as possible.
Thank you, and I appreciated the excellent data that you showed us.
And thank you to Carol Redmond for that. But I think those data are very helpful in guiding what we're doing.
Hey, Josh, could I add two things?
Yes, sir.
First one would be, I know Chair and Vice Chair have heard these and they've been on some of the task forces, but Dr. Birx met with the governor and the Vice President held a conference call with chancellors and presidents, and our governor was featured. This is about 2 weeks ago. And one of the key things they've identified is the campuses should try to keep the students on campus because of the proliferation effect. And this was the Labor Day effort to keep the students on campus. And so it's even more imperative that regardless what happens in the communities around our colleges, I think the state board needs to be prepared that we just keep forging ahead, even if we have to perhaps, shut down a particular on-premise English class and they all take it from their dorm. But the last thing we really want to be doing is sending thousands of students all back to their communities. So that would be one point. Because as you can see on the map, there's some counties, if I can be blunt, they have not particularly managed this well. And the governor hinted yesterday that he may have to raise their warning level. The second point to make is the flu season is coming. And I don't know if you have any reflections on that, Dr. Nguyen, but that could be the next big challenge is flu combined with COVID. And so we're watching that pretty carefully. That's all I have, Dr.
Yeah, thanks, Chancellor. I would certainly endorse both of the comments you made. The flu season is going to be a particular concern because what we're going to have to do, we as health professionals, if someone comes in with upper respiratory symptoms, we're going to have to assume that it's COVID, and it may well not be. It might just be influenza. So encouraging vaccination for influenza is certainly going to be important and in fact is already underway.
Josh, this is Casey. Can I make a comment on that?
Yes, sir.
I think typically it's unusual to see influenza even in November, December. Typically it's January, February, March. So I think we have to assume if someone is sick this fall that it's COVID until proven otherwise. And I think people need to be aware of that, and they do need to get their flu shots. A second thing, and this is good thinking, came through research committee, at least in a discussion with myself and Dr. Jane Hsu, the Vice President for Research at NDSU. They were on top of checking water for potential COVID, and we missed out a little bit because they delayed how they were going to do it. And on a national basis, I think maybe Arizona State University jumped in a little bit ahead of us, but we're right up there nationally on looking at research for checking water. Someone's got a delay on there.
Yeah, could someone mute, please? Thank you. Yeah, no, Casey, I agree. You know, it's research, but it's also practical. I mean, we're doing this to try to actually help the presidents react to this and the testing system. So we are, with the help of the Department of Health and the governor's office, looking to try to get samplers so that we can get even better samples. The lab at NDSU has done a terrific job. We know what their capacity is, and we're going to try to utilize their expertise to help the entire system. Now, there's already some sampling that's going on in several of the cities, and what we're trying to do is to balance the bandwidth that the lab at NDSU has with the needs, and we're working that through. But I agree with you that it really does hold promise. Maybe we're playing a little catch up, but that's okay. As long as we're in the game, I think it's going to be very helpful. The preliminary data are definitely encouraging.
And I want everyone to understand that it shows again where North Dakota colleges and universities with research are at a cutting edge on many of the things, and this one really helps the citizens if it comes through, and will help nationally and internationally, giving people ideas on how to try and manage this infection and presumably future infections.
Thank you.
This is Liz Likerski. I have a question as well. I was wondering, the data that you showed us, those graphs are excellent and really helpful to be able to see them. I'm wondering where the source of that data is from. Is that from the North Dakota Department of Health data that they've been collecting? And is that data regularly available to the institutions, and or is it possible to make that data publicly available?
So maybe I'll defer to Carol Redmond. I think she's on the call. Carol, are you on the call to try to answer both questions?
Yes, I'm here. Can you hear me?
Yes.
Good. Thank you for the question. The data that was used in these slides is provided by the institutions on their individual COVID dashboards, and I just collect it daily. There is a process in place where we're going to actually have some Department of Health data also collected directly, and that would be from their testing results. But the data that you've seen here is provided by the institutions, and it is on their public websites.
Yeah, I'll just add, I think I know that UND, for example, in some of our pandemic planning groups has looked at the North Dakota Department of Health data, and that data I think is really helpful to be able to see that in connection with like the other data that we're collecting. And so I think if there are ways where we can make that data available to the institutions like regularly, I think that could be really helpful to them as they're monitoring cases.
Chair Hacker, Dr. Wynn, this is Member Louders. Will you be sending that presentation to the board members?
So I would defer to Carol and the Chancellor. I borrowed their data, so I'd be glad to distribute it, or Carol can if there's a thumbs up from the Chancellor. So yes, Carol, if you'd be so kind.
Absolutely, I will do that. Thank you.
Oh, by the way,
Great.
since I have it in a PowerPoint, if that might be easier for people, Carol, I'll send you my PowerPoint, which was just a cut and paste, but it'll save you a couple of steps and I'll send that to you.
Thank you. Mm-hmm.
All right, thank you.
And if I could just make one other comment on the data, Ms. Louders, and thank you for your question. There may always be a glitch. There could be reporting delays. You know, I listen every morning to the UCC call, and Miss Redmond will have to get off a minute. She covers for me when I'm not there. But you know, sometimes you know a load of samples is delayed. You know, a truck has a tire blowout. I mean, there's all these information entropies. So you may find some oddities occasionally, and it's just because 11 campuses, test sites, you know, collection, transportation. So, but overall, we're getting good data over time. So just want to put that one caveat.
Any other questions for me?
Thank you, Josh. Appreciate Dr. Nguyen. We really appreciate the work of the task force. It's been critical in our ability to, you know, try to find ways to move forward successfully. And it's been the partnership with each institution, sharing best practices, their responses to spikes, and the task force's advisement and engagement, along with the Department of Health's partnership. And then most importantly, the student engagement. And so all of these pieces are coming together and have been, and puts us in the position we are in today. So much gratitude and appreciation for your work. I believe we may have Mr. Dosh on the line now with a presentation.
Yes, Chair Hacker, I'm here.
Great. Do you you have the floor, sir?
Okay. Can you share my presentation, please?
Yes, Chair Hacker, this is Terry. Cheryl, are you going to be able to share the presentation or should I?
Let's see. I don't think I just got it right now. Why don't you go ahead and share it?
Okay, I will do that. Are you able to see it?
Yes, we can see it.
Oh, you can. Okay.
Chair Hacker, Tim Mahalik here. Did I finally make it in?
Yes, we can hear you, Member Mahalik. Great, wonderful.
I've been on. For some reason, I can't get into the Teams presentation, but I'll be on the phone. Thank you.
Okay. Terry, you'll have to change your screen. We're staring at your email account at the moment.
We're seeing your email now.
You don't want to do that because there's enough there. So is that better?
Thank you. Mr. Dosh, we have your first slide up.
Okay. Chairman Hacker and Chancellor Hagrath and board members, thank you very much for the opportunity to visit with you this morning and to provide a bit of an update. I mentioned this the last time we visited, but I really think it bears repeating, and that is just a word of thanks to the university system, to Chancellor Hagrath, to his staff. This is really to get this organized and to pull this off and to protect our students has been quite an effort, and it's an effort that has had extraordinary cooperation between the university system, Department of Health, National Guard. I like the fact that we've had students involved in the task force discussions, and that's been very, very helpful. My intent this morning, and I don't want to be redundant, but I think some of the questions that have been asked regarding data are very appropriate, and that has been a major focus for us. We go to the next slide, please. So this is the schedule and the final 2 weeks in September. As you know, August was a very busy month for us as we tested as many students as we possibly could before they arrived on campus, and then also made provisions so they could be tested once they arrived on campus. We're in what we would refer to as phase 2 or maintenance mode right now, where our goal is to have a testing event on every institution's campus each week, and some of the larger ones twice a week. So this gives you an idea of the last 2 weeks of September. I think there's about 67 testing events, and there was a similar amount in the first 2 weeks. So in excess of 100 opportunities for these students to be tested. And that has been key to our strategy. And again, the cooperation from the universities, those that have student health centers, student health staff, public health have all been key in helping us pull this off. Next slide, please. We talked a little bit about the data, and Carol has been a wonderful partner in this and working with the university systems, Carol and Jerry. And as we made our way through this testing, one of the things that we wanted to focus on was the data, because, you know, initially we spent a lot of time just making sure we get as many students tested as we could, because that was our baseline. But now we want to be able to make decisions based on data. And the single source of data as we look at it is the Department of Health. So that is the answer to the question. And this becomes a very interesting and challenging task. As you can imagine, every one of those testing sites that we put up on the schedule, those swabs, those samples have to be couriered back to the state lab. All of those tests are rendered at the state lab. Once they're completed, they have to be called out. That system has been automated, where we can do that in an automated fashion with text and email. But it's you know, we have to be able to collect all that data. Who has been tested? What are the positives? How many active cases do we have? What is the rate of positivity? All of those things are important bits of information that we use in decision making. And our single source of data is the Department of Health. We've been very fortunate to be working alongside of kind of a hybrid employee that would be an epidemiologist and a data scientist, which is a very rare combination. But Ben Schramm is dedicated to our higher ed effort and has been a great resource in putting this information together. If we can go to the next slide, please. This is a sample, and we worked with the task force to come up with a format that we could use not only for the university system in general, but also break the data down so every university, every institution would have the ability to look at their data. Right now, we are in the process, we've agreed on the format. Our ultimate goal is to have a dashboard that allows any of the board members or any of the representatives from the institutions to be able to go into the portal and be able to see their individual data. This data is as of 9/16. The data this morning is actually when we pull new data, and we'll have this data refreshed through the 23rd of September. We will have that for the task force meeting this afternoon, and then all of that is provided to the various universities. But this gives you an idea of what we're reporting on: the number of tests, the number of positives, active cases, and then the rolling average on 7 and 14 days. This also is as of the 16th, this gives you an idea that of the total student population in the North Dakota University system, at this point in time, we had tested just a little bit north of 30% of the students. Next slide, please. So this is the data that will be updated weekly, and as of the 16th, this gives you a snapshot by institution as to the level of testing. Next slide, please. This gives us the number of positive cases that have been identified in that testing effort. Next slide, please. This gives us the percent of students that have been tested, and at the very top is the university system. So the average across all institutions is just right at 30%, but you can see there's quite a disparity in terms of the testing that has been done by institution. Next slide, please. Positivity also, as Carol's numbers showed, positivity also varies quite a bit, and a lot of that has to do with the amount of testing on the campuses. Next slide, please. Current active cases, and this has declined considerably since the 16th, and that'll be reflected in the new numbers today. And then the 7-day and 14-day rolling averages, if you go through both of those slides, please. I don't mean to rush through. I know we have a limited amount of time, and we'll certainly make this information available to the board. The next slide just talks about kind of the evolution of testing. Today, the vast majority of testing that we do is PCR testing, where we're doing a nasopharyngeal swab or a throat swab. That sample goes back to the lab where it is processed. Our goal is to have those results turned around in 48 hours. Although we've been able to tighten that up even more, and our new goal is 24 hours. But it's quite a process, as you can imagine, of collecting the specimens from these sites, getting them couriered back to the lab, and then rendered at the lab. We see the technology of testing evolving very quickly. You've seen, you know, news stories about this. The governor talked about it last evening in his press conference. But where this is going to is a point of care and rapid test. In other words, where we can deliver the test kits and literally the result is there within 15 minutes or so, rather than having to get it back to the lab and waiting 24 or 48 hours. This would be absolutely a game changer for our testing strategy, a game changer for keeping our schools open, keeping athletic teams on the field, taking care of our most vulnerable population. We know that the federal government has bought about, I believe, about 180 million of these tests and have distributed them to the, starting with long-term care facilities, just because that's where there is a huge concern. But we're really monitoring this closely. The lab is doing a nice job of keeping up to date, Department of Health in following the developments, and we are hopeful that you know, we will see a time when we'll be able to do this point of care rapid test with a high degree of accuracy. The test that we're using today is the gold standard in terms of accuracy. And certainly when you do a point of care and you're putting a lot of the span of control in the hands of students or people that are probably not in the medical profession, there is a larger opportunity for error or false positives, false negatives. But our ability to have a wider distribution, a less invasive distribution of tests is very hopeful. Next slide, please. So while we have done a lot of, I would call it just base testing, mass testing, as we look forward into the future, we're really focused on data. I've shown you some of the data. We look at this data every single day. We work with the universities, we work with the epidemiologists to determine where we should be testing. We always want to have at least one testing event on each campus every week. But we also have what I would refer to as somewhat of a strike force that allows us to react to those areas where we're seeing increases, you know, hot spots, and we're able to get personnel and testing supplies into those areas to be able to address them very quickly. Next slide, please. The other thing, development that is kind of a neat development, and that is contact tracing today is administered by the Department of Health. There are about 380 contact tracers that are on an automated dynamics contact tracing system. We have begun the process of establishing contact tracing pods at several of the universities. And what that allows us to do, it allows us to have contact tracing rather than 380 people in a pool that are taking contact tracing cases from around the state. It allows us to make it a little more personal, and those tracers at the universities, they know the university, they know the personnel, they may even know the students. And so we're developing these pods where the local university is doing the hiring, entering into a contract with the Department of Health, taking care of their immediate needs for their university, but also being available for the general pool as the number of positives kind of ebbs and flows. As a side note, this is an amazing opportunity for some of these students because many of the tracers are students that perhaps are in one of the medical fields at the universities, but it gives them an amazing opportunity for some hands-on experience in a pandemic. Next slide, please. We're on a compliance slide right now. And, you know, the thing that we always need to remember, and the governor emphasizes this, where there's a strong emphasis of personal responsibility that we all have, but testing, tracing, and loading the app are all voluntary. You know, we saw the numbers, 30%, a little over 30% of our student population has been tested. That means that 70 have decided for whatever reason not to be tested. The higher that percentage, certainly the higher our accuracy, the better data we have, the more that we can react in a very accurate way. Tracing, as Dr. Wynn said, is a concern today as we trace positives and close contacts. We are seeing non-compliance, you know, almost upwards of 30%, where a positive, when contacted by a contact tracer, will say, sorry, I'm not going to cooperate. I'm not going to tell you who my close contacts were. In some cases, they don't think it's necessary to isolate. And I know at the governor's press conference yesterday, he put an emphasis on that, the importance, the responsibility that we have. And so the communication of educating the students and making sure they understand the ramifications and the responsibility that they have to volunteer to be tested, to participate with the tracers. It's just such a key aspect of us successfully staying in front of the virus. Next slide, please. This gives you an idea. You can just see how, and Dr. Wynn referred to it as COVID fatigue, and I think that's a very good indication, but you can see the longer the time goes on, you know, early on in April, we had very good compliance, and now we're starting to see that fall off. Next slide, please. Quarantine, also the same thing. We're starting to see that fall off, and again, we're at such a critical time with our cases going up that it's really imperative that we get this cooperation from the students. Next slide, please, is on compliance and age. And here you can very clearly see those that are non-compliant. It really is in that, you know, 20 to 30 year category, which for the, you know, a large extent is on the campuses. Next slide, please, and final slide. We've seen a good uptick in Care19. I would refer to Care19 Alert as kind of an automated contact tracing system using technology. That app has been downloaded about 10,000 times, and we're seeing good affiliations where the students, as they're downloading the app, are affiliating to a particular university. These are the top 3 right now where students have affiliated. Probably the most important part, and really the function of Care19 Alert, is getting an alert out if you are tested as positive, a way of, by using technology to notify those that you have been in close contact, meaning within 6 feet for 15 minutes over the last 14 days. So we have had 38 instances where there is a positive and they have used the app to contact literally hundreds of students that otherwise may have not been identified as a close contact, may not have been picked up in contact tracing, and perhaps didn't even know that they needed to be tested or quarantined. So Chairman Hacker, I went through that relatively quickly, but that's our report for today, and I certainly pause for any questions.
Safety concerns and expensive equipment repairs.
Please make sure you're muting. Somebody's got some music on or talk radio in the back. It's a little disappointing. Mr. Dosh, I just want to thank you for your partnership and engagement and all of the time that you have given us as the university system to be a great partner as we navigate the way forward, the path forward. And we will commit to trying to find more ways to assist with contact tracing compliance. Maybe the institutions and their leadership can think about encouragement of Care-19 with incentives so that we're using the carrot and not the stick. But I think that's one way of one partial solution towards trying to assist with contact tracing compliance. So thank you. We will commit to partnering and finding ways forward to improve our contact tracing. It's vitally important to our success. So thank you, Mr. Dosh, for all you've provided us. Any questions for Mr. Dosh?
Chair Hacker, this is Casey. Mr. Dosh, a couple of questions. On the data you have, can you break out individually infection rate or number of infections in faculty and staff, just to see that? I mean, that becomes a crucial number and we don't want to see that go up, but it would be nice to know that those numbers are staying low. Another question is there any problem with students who may have pretty good idea that they have been exposed and might be infected and they're not getting tested? And then my third question would be, any future plans to do antibody testing, since some people may have passed knowing they might have had the infection and can be picked up by having positive antibodies, and maybe that goes to Dean Wynn.
Yeah, I'll answer the first two questions, and perhaps Dr. Wynn would be better qualified than I to answer the third. But in terms of breaking out the staff and the students, we are able to do that, and that is something that we're watching very closely also. So the answer to that is yes. What was the second question, Casey? I'm sorry.
The second question was, students, are they knowing they may be positive and not showing up? I mean, I assume if you get full testing at a site that things are going in a good way, but I mean, we've heard little statements, well, some people don't want to get tested because they know they might be positive.
Yes, sir. That is definitely a problem, and the numbers that we look at when we say upwards of 70% of the students have not been tested, some of them are asymptomatic, or they don't have any symptoms. They feel fine. They don't feel a need to get tested. But we do know of situations that you kind of hear through local public health and some of the instructors from time to time, some of the athletic coaches and such, where a student is afraid to raise their hand and find out that they're positive, and the repercussions of that in terms of quarantine, whether it's a class or whether it's a team, is pretty tough. And we look at Care-19 as a way to do that anonymously. When you're notified from Care-19, you have no idea where that is coming from, where you were exposed. In traditional contact tracing, that's really not the case, because we're asking, the contact case managers are asking, who have you been in contact with, and then they're reaching out. So there's not the anonymity there. But absolutely, to answer your question, it's happening. It's unfortunate. Sometimes it is a personal sacrifice to fess up that you are positive. The notion of positive cases walking around campus, unidentified, unisolated, is a concern. And we know that that's happening just based on the data and the positivity rate on these campuses. We know that there are students that for one reason or another have elected not to be tested and have all the symptoms. So again, educating them, encouraging them is so important. Dr. Nguyen, would you be able to answer the antibody question?
Yes, Mr. Dosh, thank you, Member Ryan and members. Actually, let me add a couple of more comments. I'm hesitating, but I think I should go into this a little bit on point number 2. So the question that I would say, that I would limit it to, Dr. Ryan, is how are we handling asymptomatic contacts, not people with symptoms. People with symptoms absolutely need to get tested and then isolate if they're positives. Straightforward. Here is the complicating thing with the CDC having gone back and forth on this. Okay, I am now a contact of someone who was positive and I have absolutely no symptoms. The expectation is that I will self-quarantine for 14 days. Assuming I develop no symptoms, after day 14, I can go back to the community because we believe, not fully established, but we believe even if I had it, I'm no longer infectious. The recent CDC guidelines suggest that people in that category, like me, asymptomatic and in self-quarantine, should get tested. If I get tested, let's say on day 7 that I've been in self-quarantine, and my test turns positive, what I now have earned is 10 days in isolation. So do you follow me? If you get tested when you're in quarantine and you're positive, at the time of your positive test, you then have to do an additional 10 days in isolation. That's, I would say, on the one hand, the disincentive for any of us to get tested, because it's 14 days versus 15, 18, 20, 24. So there could be a disadvantage. On the other hand, some students are getting tested because they rationalize it this way. If I turn out to be positive, then I know that for the next 3 months, based on current guidelines, that I'm probably, quote unquote, in the clear. And they may engage in behavior that's not as optimal. So I think the question, Casey, bottom line, about whether it's wise to test when you are asymptomatic in quarantine is a very complicated one. As far as the antibodies, a couple of comments. One, at the request of the Department of Health, they've invited both UND and NDSU to be part of a study where we would invite students to participate in looking at this. This is called seroprevalence. For the people who are not medically inclined, this requires a blood test. So unlike testing, which we can mandate, we really can't mandate blood testing, and this would be a research project where students would be asked if they wanted to participate, and if they volunteered, they would. And we are working this through. Dr. Paul Carson at NDSU is the lead person on this. UND has also been involved in this. The study hasn't started yet, but the Department of Health would like us to do it, and we may have some data to report back to you once this gets done. So yes, the antibody testing is being actively looked at, and we hope to have data within the next couple of months.
Thank you.
This is Retha. I have a question, and it has to do with the contact tracing. is there enough support from the state level to do the contact tracing in a timely manner on our campuses? We've seen a lot of just anecdotally situations where an individual knows that they are a close contact of someone who has tested positive just through communication with that individual. And then either they are never notified or followed up with by a contact tracer, or if they are, there's been a 5 to 6 day delay. And so I just want to know if we have enough contact tracers available from the state to help do that tracing on our campus.
So thank you for that question. And it's a little bit complicated, but I'll try to answer it the best I can. As the number of positive cases go up, so too the staff of contact tracers, of case managers. Prior to COVID, the state had about 10 contact tracers that were working. Today, we are right at about 380 some contact tracers throughout the state, including the pods, some of the pods that I referred to earlier in the university settings. When a test is being rendered at the lab, if it's positive, literally the scientist at the council will call a pool of nurses that we have at the state health department. The priority is always to get the positives called out as quickly as possible. So that nurse will call the positive candidates. They also call the university to notify the university. We have a single point of contact at each university that we notify them that there is a positive and the name and the birth date, so that they can begin their process of isolation and meals and online and education and all of that. The second part of that is the actual tracing, and that's where the goal is to always have those contacts called, close contacts that are identified by the positive, to have them called within 24 hours. Generally, the number of tracers that we have added has gone up very quickly. We are in the process of adding additional tracers. As of the last report that we got yesterday, we have been able to keep up and to meet that 24-hour period. Now, sometimes the tracer becomes a bit of an investigator, because we may have a name, but we don't have a phone number. When we call the phone number, they may not want to pick up because they don't recognize the name. So it can be a bit of an arduous process, and sometimes there are delays because of that. But our goal is to have adequate contact tracers in place and to call within 24 hours. If there's ever a situation at a university where you have someone that you know is a close contact and they have not been contacted by the state, the Department of Health, please give us a call. It also depends if that positive person doesn't identify all their close contacts, and they may omit them for one reason or another. The tracer, the case manager, has no way of knowing that. So there's a number of anomalies that could make that more challenging, but the bottom line is the goal is to have adequate contact tracers in place. And I would also give a shout out to the National Guard, who has activated a unit to help us in this regard on a temporary basis as we continue to hire and train up these new contact tracers. So that was a rather long answer to a short question, so I apologize for that.
No, thank you very much for explaining the process.
This is Member Bai. I have 3 questions. I think this is for, I'm not certain who it's for, so I'll put them out there. The first one is, you mentioned 30% of the students have tested. I'm assuming that's a rolling number, since that test could only be valid for I'm not certain how many days. And maybe that's the question, how many days is that testing valid for? And then the next is, I love the data that's being collected. What are you finding are the number of people who are testing positive who are asymptomatic? Is there a process in place for collecting that information? And then the third question is that you mentioned that the test that you're using is the gold standard for accuracy. And I'm wondering, and there may be a report that you could send me to that talks about the accuracy of that gold standard on maybe day 1, day 2, day 3, day 4 of symptoms or asymptomatic. I don't know how that testing is done. So is
okay,
that Dr. Ben?
Dr. Nguyen, is it okay if I take a stab at the first two and then maybe you can help me with the third one again?
Yes, please, Mr. Dash, proceed.
Okay, so remember by the data that you saw, the 30% tested is individuals that have been tested. Percent of the total population that has been tested at least once. If you look at the numbers, there have been several students that have been tested more than once. And so the number that you see are, basically individuals on campus that have been tested at least once. So that's what we're trying to accumulate here, is the number that have been tested. The data in terms of symptomatic versus asymptomatic, we do have the ability to run the numbers and say, of the positive tests that we have, how many have them been asymptomatic? In other words, they come in to be tested, they have no symptoms, but they're positive. And that number is floating around a little bit, but it has been in that 40% range. And Dr. Nguyen, in terms of the gold standard, the comment I would make on this one, generally, if administered correctly, that's a 99% accuracy. There is a variable as these people are going through the testing events. If the swab wasn't administered appropriately, if the sample was contaminated, there is a possibility. But if administered appropriately, which I feel very comfortable with this 99% number, it has a very high degree of accuracy. Dr. Nguyen, would you concur with that?
Yes, I might even go a little more. So the two major determinants that we use for any test are called sensitivity and specificity. Sensitivity means the percent of people with a disease who have a positive test. Specificity is the number of people without the disease who have a negative test. So the test that we use, the so-called PCR, polymerase chain reaction test, is its specificity is close to 100%, is in essence 100%. That is, you do not get false positives. If the test is positive, other than for a lab error where a sample was confused, if the test is positive, the person has COVID. On the other hand, if the test is negative, could we have missed someone who has COVID? And the answer is yes. We could miss it because they're so early in the course of their disease that they don't have a lot of virus yet. So it may be negative in someone who eventually turns positive. Also, if the sample that Mr. Dash mentioned, we may not get a really good sample, so the test may be falsely negative, even though the person does have virus. So what's very useful to us than interpreting it, this is the bottom line. If someone is positive, they're positive. They have COVID. If it's negative, they could have COVID, can't tell for sure, and that's why in some settings we do serial testing to try to see if we've missed anything. But so that's the bottom line about the utility of the test. But again, if someone has a positive test, essentially, other than a lab error, they have COVID. Most people who have symptoms become symptomatic about a little over 5 days after they've been infected. People who have no symptoms may remain positive. We think it probably stops in large degree somewhere around day 10, but people have been detected with positive tests even beyond day 10. We're in fact looking at doing another research study to try to answer that very question. Dr. Deborah Birx, when she visited Fargo, has followed up and asked the university system through its 2 research universities to see if we can answer the question of when PCR testing turns negative in asymptomatic individuals, because maybe we could shorten the quarantine time. We don't actually know the answer to that part of your question, but we hope to know it in a month or two when we do this research project. I hope that answered your questions. I think you're muted.
Thank you. That was very helpful. Thank you.
You're welcome.
This is Member Solberg, and I have a question as well. So in the news, we've kind of heard some things about different face masks and their effectiveness. Do you have any recommendations, or are you thinking of making any recommendations on the type of face mask that should be permissible?
I don't know if Vern or anyone else wants to do that. Let me just say a couple of things. One, the task force has really not promulgated any policy. That's really has been considered to be in the province of each campus and each president. And yes, there is a lot of discussion about the masks. The bottom line that I would say, though, is that without getting into all of the details about N95 and NK95 and removable filters and so forth, the larger thing that we need to try to get across to the campus and the campus community is that if there's one thing that has been shown to work, it is social distancing and the use of masks. So the particular type of mask, while it may be important, what is much more important in the non-hospital setting is that people use any mask. And yes, there are data that different types may be better than others, but what we know for sure is that even a mask that is not as good as an N95 is still one of our best protections that's available. So my guess would be that no campus is going to come out with a specific recommendation. President Armacost is on and can speak for UND, but at UND, we expect our faculty, staff, and students to use masks in specific situations, but we have not specified the type of mask, and my guess would be that we're not going to, but rather to double down on the importance of using masks. Thank you.
Excuse me. I was referencing more, some of the studies have shown like the neck gaiters are worse than not wearing anything at all. Do you have any thoughts on that?
Yeah, I think since I'm not familiar with all the details, I'm going to punt on that. I don't know if Mr. Dodge has any comments about it.
No, Dr. Wynn, I really don't. I'm sorry. I'm not very well versed in that.
Although, what I think what we could do is we could discuss it at the task force and see if people have more insight into it. I'm just not that familiar with the data that you're referring to, so I don't want to offer a response that may not be accurate. Thank you.
And Member Solberg, we'd be happy to do some research on that if that would be helpful.
This
Wonderful,
is Liz.
thank you.
Yeah, thank you. This is Liz Zagorski, Mr. Dosh. I had a question as well. I think the data that you showed is excellent, and actually, this was the data that I was hoping to hear about in my earlier question. So I'm really glad to hear that there's efforts underway to make a dashboard so that institutions can see this data. So my question is, because I think this data that you have is probably the best data that's out there and probably more reliable in some ways than some of the other data that's being collected, are there plans in place to share this data with the individual institutions and until that dashboard's available to them?
Yes, ma'am. That they will be provided with an updated copy. They have this first copy. What you saw was the first iteration of it. It is being updated as we speak for this afternoon's task force meeting, and then our intent is to provide that on a periodic basis so that the universities have a consistent reporting methodology. There's several different ways to look at the data, but if we're going to be comparing, institution to institution and trying to develop a coherent, consistent set of policies and best practices, we thought that having a consistent single point of truth in terms of the data would be important, and that's been our initiative. So the answer to your question is yes, that will be made available to the Chancellor's office and to each institution and this board.
Great, thank you.
Any other questions, board members? And I would just add that any board member is welcome to join the task force calls. And Mr. Dosh, thank you. As this data has evolved over time, I do join those task force calls almost every week and appreciate the work that you and the Department of Health have put into this. And that information does continue to get shared at the task force level, which every institution has a representative. Many times it's actually our university presidents joining that call. And so that's been a wonderful resource, Mr. Dosh. And again, we really want to thank you for your time here today.
Thank you, Chair Hacker, and thank you to board members.
Chair Hacker, this is Eric Olson. I would just like to note that if board members would like to attend those task force meetings, there's no issue with that. Just please contact the system office in advance so that we can make sure that if we will have a quorum of the board present, we can notice that meeting.
Of course. Usually it's Member Solberg and I are usually on there. I hear her on the task force calls quite often too. So with that, thank you, Dr. Nguyen and Mr. Dosh for your work and your tireless effort in this important matter. And it really is the crux of why we've maintained meetings every single month, because as you can tell, this conversation and this discussion is critically important for our governance as well as our institutions. With that, we're going to move down to board policy, and then we will take a brief break somewhere in here around 10 o'clock. I show 9:45. We'll see how far down we can get on board policy. So on to item number 8, Ms. Johnson.
Good morning, Chair Hacker, members of the board, and others. I can summarize the first 3. They're related to the areas of academic and student affairs. The first being State Board Policy 403.7, currently titled Common General Education Requirement and Transfer of General Education Credits. We're seeking the board's approval. We've made a number of edits to this. This is probably the most substantial of the 3. We propose renumbering and retitling this policy to Policy 460 and titling it Transfer and Test Credit Agreements. If you look at the attached materials, essentially a work group that was comprised of faculty and others representing the institution's solidified definitions of our general education transfer agreement, alternative general education curriculum, common course numbering, credit by exam, and other agreements, like MOUs, for example, and then our more recent military general education requirement transfer agreement. So those are definitions that we've added, and then solidified transfer and test credit agreement details. Essentially, what we're doing is just affirming the board's assurance of transferability of each of those components at just a high level. Each of those have corresponding procedures with significantly more detail. So one concern that was asked at almost every committee was it looked like we'd struck a lot of language around a really solid general education transfer agreement policy. But essentially all of that you see struck in the subsequent pages are transferred to a corresponding procedure. And that's actually numbered procedure 460, just in case anyone wanted to look to see that that information did truly move over there. And then we also, with that work group, revised it somewhat. So that's a summary of currently what is Board Policy 403.7. With your permission, I'll move to the second of the three. Board Policy 402.2, first year applicants, and these are fairly minor edits, something that our internal auditors just noticed some discrepancies. Some of you who have served on the board longer probably remember a number of years ago, we increased the number of core course requirements, high school core course requirements required at UND and NDSU, and we sort of incrementally phased that in. So it was currently at 13 for all 13 core course requirement units, and excuse me, and ratcheting that up to a total of 15 at UND and NDSU for applicants who were starting in the fall of 2018. So obviously we're well past that, so we can strike the language that sort of showed how we were going to move up to that incrementally. So I would really describe this as a cleanup to this particular policy. The third of the three in the area of academic and student affairs is Policy 505, International Student Health Insurance. And so, excuse me, our student health insurance now is largely utilized or designed for international students who are required to have and carry health insurance, if not provided by a national health insurance by their country. United Healthcare Student Resources is the agency that's the third party that has this for us. And the purpose of the edits to this policy were really to just strengthen the fact that refunds and prorating refunds is all under the purview of that, of United Healthcare with the students. And in the absence of that language, students were, and parents and others were contacting the system office, wanting to write to the board for a kind of a reprieve on refunds, etc. And there were just maybe 2 inquiries that I could even remember with when COVID hit, that we had international students who were returning home and were seeking refunds. And again, according to our agreement, the university system or the board cannot, that's not under our purview. So the purpose of including this in this policy 505 is just to reiterate that that is under United Healthcare's or our insurance provider's purview. So that concludes the 3 policies in the area of academic and student affairs, and we'll be seeking your approval on a first read today.
Thank you, Ms. Johnson. Are there any questions?
Chair Hacker, this is Casey. Oh, go ahead.
Oh, okay. My question regarding the transfer and the testing, is that going to make it easier for AP credits to transfer from institution to institution?
Thank you, Member Mathern. I guess I'd have to examine more which AP credits might be having difficulty in transfer. So we maintain matrices of, for example, CLEP, AP, International, Baccalaureate, Dante's, and all the campuses are asked to review and honor those. The one thing we do is we do let faculty have a significant amount of latitude in agreeing across the state what the AP score is required for the transfer of credit. So AP would recommend a passing score of 3, but faculty, if they agree as a discipline group, they would like to see a passing score of 4 or higher. They do have that ability to require, but we add that to the matrix, the credit by exam matrix, and all institutions honor that. So if there are any AP scores that haven't been reviewed, the good news is with our new hire in the office, Claire Gunwall, She convenes the faculty discipline groups, and we can review additional AP exams with the participation of the faculty in adding AP exams that may not have been on the matrix, but we do ask all institutions to honor those in transfer. And parents, families can write to the university system office, and they do, if they feel that those weren't honored in transfer.
Thank you.
Mm-hmm.
Member Ryan, I think you're muted.
Chair Hacker, I would move approval, first reading policy 403.7, policy 402.2, and policy 505 as presented by Lisa Johnson.
Thank you, Member Ryan. Is there a second?
I'll second that, Member Louders.
Thank you, Member Louders. Christie, if you would call the roll.
Ms. Nesset?
Yes.
Ms. Solberg?
Yes.
Mr. Mahalik?
Yes.
Dr. Louders?
Yes.
Ms. Bai?
Yes.
Dr. Ryan?
Yes.
Or Chair Hacker?
Yes. Thank you very much, Board. That brings us to item number 11. Ms. Grundy.
Good morning, Chair Hacker, members of the board. This is first read of Board Policy 611.1. It's called Employee Responsibility Activities Medical Service Plan for the UND Med School. This policy was reviewed as part of our routine review of policies older than 10 years, and it was sent to the UND Med School. And so these changes are brought forth from their policy committee. So today I'm presenting first read. And the purpose of this policy is to define the UND Medical Service Plan, which is the vehicle for faculty, physician providers to charge contracting hospitals or other organizations or patients for clinical and other services related to their professional skills rendered. So this plan administers the distribution of revenues generated to the faculty member, respective department in the school. As I said before, UND reviewed this policy and they are recommending two changes. So the first minor change is obviously updating the title of the UND Med School to the School of Medicine and Health Sciences. And the second change is to remove the reference to full-time physicians and full-time faculty physicians. So your latest draft, or I should say that removing the full-time requirement would open up this plan's eligibility to their more participants. Your latest draft does remove all of the full-time references, and I'd be happy to answer any questions regarding the changes.
Thank you, Ms. Grundy. Any questions?
Chair Hacker, this is Nesset.
Yes, go ahead. Member Nesset.
By making that change, Ms. Grundy, does that incur an additional expense to the to UND?
Thank you, Member Nesset. I do have Laura Block on the line. She's the Associate Dean for Administration and Finance at the UND Medical School. Laura, would you be able to answer Board Member Nesset's question?
Yes, thank you, Ms. Grundy and Ms. Nesset. No, the change to deleting the full-time was to allow additional faculty providers to be able to participate in the plan and would have no effect to the University of North Dakota. In effect, there may be more part-time faculty members who could participate with the medical service plan.
Thank you.
Thank you. Any other questions, board members?
No. Chair Hacker, Member Mahalik here. I would make a motion to approve first reading of policy 611.1, employee responsibility and activities, medical service plan, UND Medical School.
And Nesset, I'll second.
Great, thank you. There's a motion and a second. Christie, would you call the roll?
Dr. Louders?
Yes.
Ms. Solberg?
Yes.
Mr. Mahalik?
Yes.
Ms. Nesset?
Yes.
Dr. Ryan?
Yes.
Ms. Bai?
Yes.
Or Chair Hacker?
Yes. Thank you. That brings us to item number 12, waiver of 1203.1 digital accessibility. Mr. King.
Good morning, Chair Hacker, members of the board. Before you is a request for a COVID-related waiver to policy 1203.1, which is our digital accessibility policy. That waiver would last through January 1st of 2021. It's just simply, to give our campuses adequate time to make sure that they have the procedures and the process in place to make sure that we do this really well. The good news is a number of our campuses already have this procedure in place. Others are very close to implementing it. Working with Mr. Olson, we felt like it was better to waive it just to make sure that this is done correctly. So with that, I would stand for questions.
Thank you. Any questions?
Chair Hacker, this is Member Louder's motion to approve the waiver to policy 1201.1 digital accessibility.
This is
Thank you,
member
Member
five,
Lauder.
second.
Great, thank you. There's a motion and a second. Christy, if you would call the roll.
Dr. Ryan,
Yes.
Ms. Nesset,
Yes.
Ms. Solberg,
Yes.
Dr. Louder,
Yes.
Mr. Mahalik,
Yes.
Dr. Ryan,
Yes.
Ms. Bai,
Yes.
Board Chair Hacker.
Yes. Thank you very much. That brings us to a good point in the agenda here to take about a 5-minute break. I'm showing 9:57. Why don't we come back together at 12:05? Feel free to shut your camera off. Excuse me, 10:05, not 12:05. That would be a little long. 10:05, we will re-adjourn and see you in a few minutes.
Casey, can you hear me?
Yes, I can.
Oh, for some reason you were filling my screen. I don't know what you did if you shared your screen or your camera, but.
Well, I was having, I was doing some, looking at my other medical stuff. I'm in my office at work.
Just letting you know your face had filled the screen so I could actually see your iris. It was so close.
Good.
I have no idea how the system picks who it's going to display. It's very interesting. So.
Yeah, it seems to be a random bounce around the system.
Yeah.
But no, I'm here.
You're back in a little square now. So.
Yeah, well, if I move back, maybe it's easier. I don't know.
No, it actually it selected you. It put you in front of everybody else. It was very odd. I don't know why that would be. I was just letting you know.
Do you want to call me after when it works for you?
Yep, sure thing.
Why don't you do that? I'm open all day after the meeting.
Okay.
Anytime.
Hey, it's Andy, and I think Dr. Ryan showed up because he was the only one with his camera on, and when you turned yours on, he was the only one to show you. So mine was off, and I saw his irises as well. So.
Yeah.
Yep. Well, it's good. The day is a good one. Good to see you, Andy.
Good to see you as well.
Doing a great job at UND, so keep it up.
There's certainly a lot happening, of course, and between COVID and presidential executive orders and the like, a lot to talk about.
Well, you're doing a good job, so keep it rolling.
Great, I appreciate it. Thank you very much.
Okay, board, I am showing 10:05, not 12:05, but 10:05. If we could turn some cameras back on so I can kind of see who's here and make sure we're all back together. Member Mahalik and Loiters, are you still on the line?
Yep. Yes, I'm here. This is Jill.
Great, thank you.
Retha's still here.
And
too.
Retha? Okay, great, thanks, Retha. All right, we will come back to order and move back into board business with item number 13, which is the NDUS Foundation appointments. Chancellor?
Yes, sir. Thank you. Well, for those new board members who don't know, we've had the NDUS Foundation around for 30 years next year. It was created by President Clifford when he was the acting chancellor, and I think Governor Schaefer signed off on it. It's evolved into a advocacy for all the colleges. It used to be just, I think quite frankly, just focused on the board and board social, whatever budget things are required. But it's basically a statewide entity with priorities in the oil industry, nursing, manufacturing, and cybersecurity, which was the governor's K-20 initiative. We've got a great board. Tim Mahalik is the chair with experience, of course, in banking and finance, and Cindy Schreiberback in legislative experience plus industry. Julie Traynor, Dakota Nursing. Sorry, that was the other priority, is nursing. But we've had some turnover. Dr. Scogan retired, so we need to appoint Dr. Shirley and thank him once again for that volunteer spirit that he's known for. And then, Mr. Wetch had, before his first board meeting, had to step down. I want to thank Member Bai for stepping in, but she also has petroleum background, which is very important priorities. And so we would need to renew Mr. Warner, who has both background in agriculture. He was in the sugar beet field and then built a tech company. And Mr. Bacchus, who's got banking and law, finance background. Renew both of them and then appoint President Shirley and Bai. But really appreciate what they've done on the board so far. including helping Bismarck bring home a couple $1 million from a Silicon Valley firm by representing the whole system in their cyber programs. So that's the board action I request, Chair Hacker, is to reconfirm Mr. Warner and Bacchus, and then to approve Dr. Shirley and Ms. Bai onto the board.
Chair Hacker,
Thank you, Chancellor.
Member Mahalik here. Oh, I would go ahead and make that motion as recommended by the Chancellor.
Chair Hacker, this is Casey. I would second that motion.
Okay, thank you. There's a motion and a second. Christy, if you would call the roll.
Ms. Solberg,
Yes.
Dr. Ryan,
Yes.
Mr. Mahalik,
Yes.
Ms. Nesset,
Yes.
Dr. Louders,
Yes.
Ms. Bai,
Yes.
or Chair Hacker.
Yes. Thank you, President Shirley and Member Bai, for your service on the foundation. With that, we'll move into the Chancellor's goals, and apparently that one has my name by it, which is appropriate, but you'll see attached to the agenda the goals of the Chancellor for the year ahead. We review these every year, and I would add that this year Vice Chair Ryan and I did review them and provided feedback to the Chancellor that was incorporated into these goals. And I would just add that that the Chancellor was kind enough to agree to put additional focus on mental health issues, continue some focus on hybrid campus models, such as Dickinson State University and BSC making their transitions last year, to see if there's other opportunities to do similar models across the system. And then also to add some focus on career academies. Those have been kind of a highlight of success for us across the system, and to see where we can find more opportunities such as those. Are there any questions on the goals that are outlined? Otherwise, we can ask for some comments from the Chancellor too. Chancellor, do you want?
Oh, sorry. This is Liz.
Chancellor,
I have a
Sorry,
question,
Liz,
but I
go
can
ahead.
wait till after the Chancellor, if you want, whatever.
Certainly. Well, you'll recognize them. It's a very similar layout and structure in the past, but some of the key additions, in addition to what Chair Hacker said, is that obviously the pandemic that has become, the sustainment and recovery. Just like Dr. Wynn hinted, it's almost like we'll have to rename the task force from restart to keep going. And it's an absolute tribute to all the campuses. There's been major campuses on the East Coast, in Midwest, in just chaos, lawsuits against faculty, staff, organizations. And so that is obviously taking an enormous amount of time, and that's why it's number one. Then, of course, it's a legislative session. So if you look at the goals over the last 5 years, in the odd year, a huge priority going forward is the legislative session. And as Chair Hacker has coached me, being a state senator in his background, this is going to be a legislative session like no other. The tight budget conditions. And then what I would typically do is right now I'd be circulating around, listening sessions, driving in the car, and we are working with my staff how to engage legislators when they can't be in the room, and I don't want to risk being a vector. Then other ones you'll see, goal 3 is we have already begun the study of eCore, which I want to thank Chair Hacker pushing us to try to be even more innovative. That's page 2, top of there. And I want to thank Dr. Lefebvre volunteering to lead that, as well as Dr. Armacost and Miller. And they're already setting up their first meetings to brainstorm through that and see how we can explore that idea of better running as a system efficiently and better student education. Most of the other ones you'll see are continuing priorities that the board had identified, digitization, workforce. In the digitization field, just yesterday, we have hired now for the Dakota Digital Academy, and I appreciate your support on that back in June and in the cabinet last August. We've got to do more in the whole digital workforce. It is incredibly hard to recruit digital savvy professors. In fact, our neighboring state, I've just been told, has reached out to the chair of one of our major digital efforts and is asking if they can partner with us because they cannot hire the talent they need. So it's very timely that we think as a system on this and potentially even regionally. Of course, goals related to my own staff. We're very diverse staff, vast majority gender diverse. We can still do more on ethnicity, climate, and we'll continue to work on those. And as Chair Hacker said, as far as Section 5 of goals for the campus, we put behavioral health at the top of that. And number 2 is the high flex online programs. And you'll see colleges doing amazingly innovative stuff. And in some cases, in some colleges, things they have never done before. And so we've got lots of new presidents. Mentoring and helping them on board is a big part we're doing. I call all of them a couple times a week, quite frankly, because they are on the front line. 5D, I call your attention there. You approved about a year ago a modification to the presidential evaluation system, and 3 years ago, a modification. 3 years ago, you approved breaking out the 2-year schools in the fall, 4-year in the spring. This year's a little hybrid because of the COVID. That's why you're seeing the evaluations of the 4 years now. But typically 4 years in the spring, 2 years in the fall. What you approved last year was every 3 years doing a real deep dive, really looking at, how is their CFI trending over several years? How is their retention trending over several years? Because it's unfair to a president going, why didn't you change retention in one cycle? So because of COVID, that has delayed a little bit of that. But I want to call your attention that we will be getting on to what you asked me to do, starting with 1 research university, 1 regional, and 1 community college in the next cycle. Then that's a deep dive, campus listening sessions, and giving them time to show 3-year return on initiatives with the big caveat of what did COVID perhaps do. And the other big change, or modest change in some sense, was we wanted to button up our strategy review in June, but wisely again, Chair Hacker pushed back a little bit on me, and Phil Wise kept going, can you put a strategy review and put a bow on it when we don't even know if we can restart? So, and we were hoping to do that today, but once again, we see the governor's about to put a bunch of counties in further situations. So a big part of what we will be doing this coming years is absorbing the strategy lessons of COVID, and by later next spring, at the chair's direction, hopefully get a further modified strategy, which was a goal I'd hope to get in June. I believe that's the high point, sir. That's all. I have it open to questions.
Thank you, Chancellor. Member Legursky.
Yeah, thank you. So I had a question in particular. I'm glad you mentioned Goal 3A about the open education initiatives. I was wondering if you could maybe give us some more information about the study groups that are being formed. And I guess my second question is related to, I know there's maybe some sense that part of this initiative will require sort of uniform use of certain OERs across the NUS system. And I think faculty are not very excited about that sort of idea because it starts to impinge on academic freedom and can be a challenge to implement like a single text over an entire system. And so I'm wondering if maybe you can clarify that, if that's part of the discussions or not.
Yeah. Well, I can say right now, you will definitely be involved. This is just the cabinet has been, in some state systems, there's so many retired chancellors and vice presidents, they have whole think tanks and they do these studies, and we don't have that in North Dakota. So really, our education higher ed think tank is the cabinet. And I even mentioned this to Dr. Lefebvre yesterday, is begin to get the volunteers from faculty and people who are willing to help study this. So the first thing is getting his 3 presidents together, and then they'll be sending out the request for volunteers and faculty input. So of course we wouldn't do this without the faculty, but yeah, so rest assured, you'll be asked for input.
Okay, so some of those details then are not necessarily, haven't been decided yet at this point.
That's why it's a study, right? And it'll come back to the board.
Okay, great, thank you.
But I can just say this, is that as Chair Hacker has pointed out, we're at a flex change in history. There are states where the state funding it's almost a joke. It might be 3%. Our state is generous, but they expect transformation and change, and to try some things that may not work. We may try something a couple years going, okay, eCore worked in nursing, it worked in digital programs, but it didn't work in XYZ, you know. But we have to keep showing change and leaning forward, and so that's what that's about.
And I would say some of this has been born out of the strategy sessions that we completed with the governor previously in regards to the level of content creation that is going to occur and is already occurring as we speak with online courses. And it's how do we take advantage of this massive amount of disruption that we are in the middle of, to ensure that the entire system and all institutions are on very strong footing post-pandemic. And so engagement from all levels, that's going to include faculty, staff, students, presidential leadership. But it's what do we do with that content, and how do we ensure that we have the highest quality content, as well as how do we reward those content creators, Member Legursky? And I think that's a big piece. And that's not missing from those early discussions with the governor. And it was really high level. And so now what we're doing is really looking at, let's take advantage of this opportunity, pull the right people around the table to look at what can we do to advance and to stay near the top of the list as it relates to online education, which will be prevalent post-pandemic. And so we don't want to simply just claw our way through a pandemic. We want to take advantage of that disruption and find areas that we can win at the end of the day as we come out. So a lot of details need to be fleshed out. We don't even know the right questions to ask yet. And so we're very early and appreciate your engagement.
And I would just say that the campuses are doing a remarkable job. As you saw in recent reporting, some campuses actually have enrollment growth. Dickinson grew 6% in the face of a pandemic. We had a huge victory. The Navy Marine Corps is building a community college with civilian partners, and we were selected out of a competitive group which could yield tens of thousands of students. And we were selected largely because of the quality of our programs, but so many were online. And so, like Chair Hacker said, we've got to see where else we can capitalize on a systemic group of talented people. That's all I have, sir.
Chair Hacker, this is Lisa Johnson.
Yep.
I just wanted to add just some ongoing work around open educational resources. The university system did commit about $250,000 of monies dedicated to shared services to OER. And within the last couple of months, awarded, I think it was 41 individuals, around 50 individuals, stipends to explore open educational resources, develop open educational resources. And we belong to the Open Educational Network that is a library. And our library system's been great. They've been helping at each campus have these repositories and access to open libraries. But one of the things we're doing in when we do our Open Access Week is putting webinars out for faculty to learn how to not only create, but basically get their developed textbooks into these repositories accessible worldwide. And so I think that might be the next step, is for faculty who are developing these resources, getting them into, and what are the kind of the logistics and legal parameters in terms of, you know, sharing that with others. So that's sort of a goal of ours as we advance.
Thank you. Great point. Thank you, Ms. Johnson. We do need to take action on the goals. Is there any other discussion?
Chair Hacker, Chancellor Member Louders, just a quick comment. Really appreciate the attention to mentoring for system executives that are new to their role or new to North Dakota, wanting to see continued work in the area of alignment at each campus with system goals, and that is happening. And I really want to commend you, Chancellor, for your work in that area. So thank you for your attention to that goal.
Thank you. And I would build on Dr. Louders. I'm sorry, I keep forgetting to call you Dr. Louders, so I'll work on that. You know, I have a goal that we try to have as diverse staff as I can have. But as the board, as you hire presidents, you know, I'm mindful we need to keep looking at increased diversity. There was a time we had 3 women presidents, and now we have none. It really couldn't be my goal per se as the board hires and fires, but I'm totally on board with that, Dr. Louders, that you've made that a priority in our discussions.
Thank you.
Chair Hacker, this is Casey. I would move approval of Chancellor Hagerot's 2021 or 2020 and 2021 goals as presented, and thank Chancellor Hagerot for all he's doing for the North Dakota University system.
This is Nessa. I'll second that motion.
Thank you. There's a motion and a second. Christy, if you would call the roll.
Dr. Ryan?
Yes.
Mr. Mahalik?
Yes.
Ms. Bai?
Yes.
Dr. Louders?
Yes.
Ms. Solberg?
Yes.
Ms. Nesset?
Yes.
Board Chair Hacker?
Yes, thank you. That brings us to item number 15. Annually, we adopt our tentative schedule. It's not necessarily tentative, it's kind of set, but as a reminder, the dates are flexible. And so I did take a look at these as prepared by the system office, and I think Vice Chair Ryan did as well. And kind of, you know, they're pretty traditional dates for which we generally have our meetings. Of course, the chair of committees, it's at their discretion to, you know, if they need to move a date to fit their schedule. We just ask you to look at this and try to give the system office some advance lead time if you need to move a date here and there for your committees. We did look at the overall regular board meeting schedule, and it looked appropriate. So we do need to adopt the schedule by law.
Chair Hacker, Member Mahalik, I'd make a motion to approve 2021 meeting schedule.
Chair Hacker, this is Casey. I would second that motion.
Thank you. There's a motion and a second. Christy, if you would call the roll.
Ms. Solberg?
Yes.
Ms. Bai?
Yes.
Ms. Nesset?
Yes.
Dr. Louders?
Yes.
Mr. Mahalik?
Yes.
Dr. Ryan?
Yes.
Board Chair Hacker?
Yes, thank you very much. And that brings us to item number 16. And Ms. Grandy, this is our fiscal responsibility and fiduciary responsibility to ensure that we're apprised of the retirement plan. And we are going to have approximately a 45-minute presentation from TIAA-CREF. Ms. Grandy, if you would do the introducing.
Yes, thank you, Chair Hacker. Before I do so, Terry Meyer, I just forwarded you the presentation that I was going to queue up, but as I was trying, it appears I don't have rights. So if you would please open up the TIAA presentation and share your screen, I'd appreciate that.
I will do that.
Thank you, and then I will come over and help drive the slides. So I am happy to introduce our TIAA representatives for today. Melissa Thorpe is our relationship manager, and she is the relationship manager assigned to the NDUS retirement plans. And also Colby Lowell is the director of institutional investment strategy, and Colby will be facilitating the fiduciary training today. So welcome and thank you for joining, and I will turn it over to Melissa.
Hi, good morning. Jane, can you hear me?
I can, Melissa. Thank you.
Great, great. Okay, so good morning, Chair Hacker and members of the board. Colby and I are really happy to be here. As Jane said, my name is Melissa Thorpe, and I've been a part of your dedicated service team for about 2 years now. So what I had prepared was to do just a high-level plan review and allow plenty of time for your questions. As you've already mentioned, this is just part of your responsibility to periodically review the retirement plan. So I apologize, I can't see the screen share, so I just want to verify that the plan review title slide is visible.
Yes, Melissa, it's visible. And I'll have
Perfect.
Terry advance, and you can just say, well, we'll help you out here, and we'll advance as and follow your discussion item appropriate to the slide.
Perfect. Okay, so we'll just begin on slide 2. This might be new information for some of you, so I'm just going to keep it, at a very high level, and I also want to be respectful of time, just since we have a lot to cover. So essentially, what you see there on slide 2 is it just illustrates that the key metrics that we're going to be looking at, it illustrates the retirement readiness for your plan participants. And it all comes down to the income replacement ratio. So if we go ahead and advance to slide number 3, this is the high level system-wide snapshot. And based on the data that we have and the analytics that we run, the participants are on pace in the upper left-hand corner. They're on pace to replace 94% of their income in retirement, which is outstanding. That's a strong prediction, and you're ahead of your peers, and that the outcomes number has actually been going up when we do a look back over time. Under the outcomes, we're going to talk a little bit about the annuitants, those that have opted for the guaranteed lifetime income. That's a really critical piece of the retirement strategy, as I'm sure many of you know. And then in the center there in the purple, we just look at all the variables that are going to impact retirement readiness, like what's flowing into the plan, what's flowing out of the plan, are the plans growing year over year? And then we also look at, just allocation and how the participants are invested. We're going to also break it down by age and gender. So one thing I really like to highlight on this slide number 3, is in the lower right-hand corner, participant engagement remains really strong. 2020 has been such a turbulent year, and more than ever, your staff and your plan participants, they're dialed into their account. They're seeking advice session. They're actually bumping their deferrals. Rebalancing, that's naturally going to happen, not necessarily in response to the market volatility, but the people in North Dakota have always been incredibly engaged. And as you can probably imagine, back in March, we did a pivot just like everybody from being on campus to virtual. And what we found is we could actually open up a lot more appointments, but also your plan participants could then pick a date and time that's best for them. So we've seen really strong trends in participant engagement. So let's go ahead and go to slide 4, just so we can drill down on that 94% income replacement ratio. You'll hear us talk a lot about the guaranteed income versus, the variable piece of your retirement income. And when we look at your plan, we do like to compare it to a peer group. And you can just see, the strong data behind that income replacement ratio. Now, some of these numbers, given the payroll data that we get, we do the calc and the assumptions. So we can certainly dive into some of the methodology behind the number if you like. Let's see. So we also, slide 5, we also like to look at trends over time, and nothing has really changed over time in terms of flows or allocations. That's slide 5. Slide number 6, just more, and I'm sorry, let's go ahead and go to 7. We just, again, look at the trends and how your folks enroll into the plan. And if you go to slide 8, this is where we can really drill down into your plan participant population, whether we're going to target like an age band or target, the male-female demographic. But really we see consistency across the board within your plan, whether it's diversification or savings trends. So I'm going to pause on slide 8 just to see if there's any questions so far. If there was something that stood out to you maybe on the diversification by gender in the lower right, you can always drill down deeper. Slide 9 just shows a little bit further breakdown on allocation by age bands and gender. So, I've mentioned 2020 has been pretty phenomenal, as we all know, this group especially. What we've been monitoring, and I'm going to jump to page 12, we've actually been closely monitoring to see the financial impact to your participants. And one thing that may or may not be surprising is there really was not a spike in new loan requests, and that is shown on slide 12. You could also look at slide 13 to see if there was a bump in active employees taking a withdrawal out of their account. And, for a number of reasons, and Jana and I have discussed this, the folks in North Dakota have really stayed the course. They've held steady, and we really haven't seen any disruptive trends that you might have expected to see given the year that we've had. Slide 14. This is probably my favorite illustration in the entire plan review. The value of guaranteed income cannot be, it cannot be understated. The fact that your retirement plan offers your people an option to annuitize, and then that payment would be guaranteed for life, that's a very valuable feature that not all retirement plans offer. And so you have almost 1,200 annuitants. Average payment 10 years, about just shy of 14 years. But what I really like to highlight is in the lower right-hand corner, you have a retiree in your plan that's been getting a guaranteed payment for 42 years. I'm going to guess that person is now north of 90, and they probably started very early on. But the largest annual payment, 20-year retirees, is $126,000 annually. So, that brings a great amount of comfort to folks to know that at least one piece of their retirement income is going to be guaranteed for life. So this is a lifetime income slide. Again, my favorite. If you wanted to, drill down into your plan, obviously you've got your actives where you have the most influence, but slide 15 shows the inactives, those that are not currently active with the university. And the reason this information is important is just if the plan, if you wanted to consider, potentially targeting those that are no longer active and they're under $5,000 in their account, you could take a look at those folks and see if you might want to potentially, urge those folks out of the plan. So we can certainly talk more about that to see some plans decide that maybe they want to clean up the inactive population. So that's why this is in here. So considering the dynamics of your plan, and I'm going to jump to slide 17, we monthly send your HRC the communication, the education, the webinar schedule, everything that's designed to reach all of the plan participants at any stage of their career. So what you're seeing here on slide 17 just really goes beyond, their age. It's really more about life stage. And what I like to say is, no two 50-year-olds are exactly the same. By the time you reach 45, 50, 55, life has happened and we're all at maybe a different stage. So we really design our education and engagement towards these 5 stages and not necessarily just their age. So slide 18 is going to show you just kind of a breakdown of where your population lands. So really to be expected, the 3 categories in the middle, the life builder, accumulator, transitioner, it makes sense that the bulk of your folks are there. And then down the left-hand side, you can see the types of communication strategies and engagement that we've designed for that group, and then the actions that we hope to accomplish given those segments. Okay. If we go to slide 19, there's a lot of investment detail included in your plan review. So what we'll look at on slide 20 is not just where the assets are but where the contributions are flowing. And the reason that's important is, of course, you know, you've accumulated assets, but new money that flow into the plan, you know, doesn't necessarily align with where the assets are sitting. So it's important to look at both. And again, you can look at this over time. We compare the rolling 12 months to the prior rolling 12 months, just so you can identify any trends. And that's what you're seeing on slide 20. Slide 21 shows not only the top 5 investments, but the bottom 5. I think it is interesting to kind of look at the most heavily utilized holdings, whether it's by assets on slide 21, or you can look at slide 22 to see where the contributions are flowing. On slide 22, you probably noticed some target dates in the top 5 contributions. You know, the plan contributions, about 40% are flowing into target dates, but only about 17% of overall assets are sitting in target date funds, the entire suite. So the breakdown on this begins on slide 23, and you can just target whether it's the number of participants or contributions or assets, and those are those same categories, whether it's guaranteed, multi-asset, equities. You know, that's just essentially the high-level breakdown, so we can study the diversification within your plan. So slide 23, 24, 25, again, it's just all the breakdown of all the funds within your plan. And I feel like this is a good point to mention, you know, something that's important for this group to be aware of, but something that's not actually shown in the presentation, is all the funds in your retirement plan are going to generate some sort of revenue. And how the record keeping is set up is any fund revenue generated goes towards the record keeping expense. You know, TIA, you know, we manage the assets, we answer the phones, we print the statements, we deliver everything. So that's the cost. That is the record keeping cost. Any revenue that's generated by your plan that's above and beyond that record keeping cost, any excess fund revenue, is actually flowing into an account. And that account is called a revenue credit account. And what happens is each quarter deposits are made into this account. And so seeing as how we're approaching the end of the year, it's time for this, you know, the group to be aware of how the plan economics works and how it funds this account. And then it's up to the group to decide, you know, if this account should be credited back to participants, and that's what you've done in the past, and that's typically been done in fourth quarter. The account can also be used to pay necessary and reasonable plan-related expenses, you know, whether that's an auditor, a consultant, something that's necessary for the plan. So the recent balance in the account, just so you know, is about $460,000 in the account. So I just bring it up so the discussion can begin on what you'd like to do with that. And you could do a combination of a participant credit or covering plan-related expenses. So I'd like to pause there and ask Jane if I've missed anything that you would like for me to cover.
Thank you, Melissa. I just wanted to clarify the overview you just shared on the revenue credit account. Thank you for that. And the Retirement Plan Oversight Committee, where the board has delegated some of these areas for discussion and recommendation. We did just recently discuss the revenue credit account, and we will be making a recommendation to the Budget and Finance Committee for the distribution of those funds. So the board can rest assured know that you'll be seeing that in the very near future. Other than that, Melissa, you've hit all of the high points. Thank you so much, and I'll turn it back over to you.
Perfect, thank you. So at any time, you know, you have questions or you want this type of information on a campus level, please do not hesitate to reach out. Were there any questions?
Yeah, Melissa, this is Member Mahalik. Just a quick question. I noticed as you take a look at the number of accounts under 5,000, we're approximately like 1,329. Does it benefit us at all to exit those accounts from a fee perspective, or how do you see that? I guess it's really my first review of this, but just curious.
Yeah.
There's a lot of accounts
Yeah.
with small balances. Does it help for us to encourage, or how would we go about encouraging that, and what impact would it have?
Yeah, great question. So the first thing I would need to do is just review like the plan doc language, because to do, you know, it's called a force out or de minimis or low balance distribution, whatever it is, you know, that you'd like to call it, the plan has to adopt the provisions. And typically those provisions say anyone under 5,000 can be swept out of the account into an IRA. If the account is less than 1,000, you have the option just to distribute either to an IRA or just to send a check. So for a plan of this size, you know, cleaning that up is something you could consider to do maybe annually. There's not really going to be an economic impact. It doesn't, you know, you know, you want to, I guess, some plan sponsors do it just to reduce the administration, just to reduce the head count. But I can't think of a, you know, a direct benefit to you besides just, you know, getting a reminder out to those folks. Many times they've forgotten about their balance in the plan. So did that help at all?
Yeah, okay, thank you. I mean, again, you talked about TIA record keeping costs. I'm assuming you're sending each one of these a statement, you know, and all that continues to be part of the package, so to speak.
Yeah.
And, I mean, there are costs involved with that, and I would think that would go back to the revenue credit account. So, just curious. So, thank you.
Yeah, of course. That's something that it certainly factored into the pricing, is the head count and the flow. So I think I'd have to dig a little deeper to kind of see the true, you know, if we could therefore reduce our costs. I know I've been working with Jane to identify some efficiencies so we can bring costs down. So I'll put that on the list of things to investigate.
Thank you. Yeah, I just think, you know, the less reports, the less information in and out probably benefits not only ourselves, but your time and effort as well. So thank you.
Yeah, that's a great question. Are there other questions before we move on to Colby?
Hi, Ms. Thorpe. Nick, this is Nick. I believe do you recall when we made a small change to the plan document that, you know, kind of freed up those low balances to have an easier ability to do rollovers into an IRA? I thought we made a change here just a couple of years ago.
I don't have your plan doc in front of me, but I could sure look back just to make sure that provision was adopted, and I can find out when.
And Ms. Grindy, maybe you can look into that and bring that to Budget and Finance Committee when you guys bring those recommendations.
Sure, Chair Hacker, I can answer that question. Yes, you're absolutely right. The board did make a change to the 401A plan, the main plan, a couple years ago, because there was a provision that once somebody terminated the system, their money had to sit there until retirement age, and the board did eliminate or lift that restriction for any terminated employee to do as they wish with their funds, and there's no cap on that. So that has been opened up. Okay. Thank you.
Okay, thank you.
Great questions. Anything else for me?
Ms. Thorpe, thank you for your presentation and thus far. So thank you.
Yeah, absolutely. And I appreciate your engagement as we turn it over to Colby, and Colby's information begins on slide 34.
Thanks so much, Melissa, and good morning. And still morning, right? Yeah, 10:46 in North Dakota. So good morning, everyone. Happy to be with you all. You know, few of you I've met previously, but for those I haven't, again, my name is Colby Lowell. I'm based in Denver, Colorado, and cover the entire West Central Territory for institutional investment strategies. So anything really menu related on up to what we're covering today, which is fiduciary education. So I will kick it off. Don't want to waste any more of your guys' time. I know it's a long morning and afternoon for you. So you know, like Melissa, I wasn't able to get into the Teams meeting, so someone's driving this for me, correct?
Correct, Colby. You can just say advance or the
tell you when
slide number.
Cool. Just you got it. Just tell you when to flip. So I will start right on slide 2. Just high level agenda for today. What this deck is aimed to do is really provide a high level understanding of the role that you all play with regard to the retirement plan as fiduciaries. So what we're going to do is we're going to talk about who's considered a fiduciary under ERISA guidelines, the duties of the fiduciaries, the not so fun stuff, which is potential liability or breaches of those duties. And then we'll finish kind of with best practices and ways to help minimize risk to you all. I guess it can be considered both ways, not only to the fiduciaries, but also for the plan participants. And of course, to drive the best possible outcomes for all plan participants as we can, right? That's generally the aim of your committee. And so we're going to kind of walk through this presentation, and please stop me with any questions, or if you want to dive deeper into something, happy to pause and dig in a little bit. So let's go to the next slide. What makes someone a fiduciary, right? So generally speaking, these are sort of the high level, legalese that you're going to see, under ERISA guidelines, but it's anybody who exercises discretionary authority with respect to the management of the retirement plan or the disposition of the assets of the plan, right? So those are kind of the two big points. And in addition to that, it kind of falls down into the responsibility to actually administer the plan. So a lot of the day-to-day activity operationally falls into the fiduciary role. And then finally, providing investment advice for fees. So that kind of falls into the third-party consultant realm. If an advisor is hired to help a committee, make investment decisions and drive outcomes through the investment menu for your participants. Next slide. So the activities that kind of drill in a little bit further to those high-level points I just mentioned are, again, selecting, monitoring plan investment vehicles, interpreting plan provisions, selecting third-party service providers. So that would be anybody like I said, a consultant. That could be an auditor. It could be a general counsel, right? An outside counsel to help with the plan. Exercising discretion over any and all claims. Providing investment advice for a fee, that falls into that consultant realm. You'll see there's a lot of language built into third parties because in the world of higher ed specifically, we're seeing an increasingly greater presence of third-party advisors, investment advisors coming in to help committees with some of the burden with regard to investments. Holding plan assets, that would be if the plan assets are actually held in trust outside of the actual sponsoring employer. And finally, selecting other fiduciaries. So again, just sort of zooming out again, and really if there's anybody brought into the party to help address decisions that are being made, that the selection process is a prudent one. Next slide. Great. So ERISA not only qualifies who a fiduciary is, like we said, a party who exercises discretionary control and or authority over management, administration, and ultimately disposition of assets, but it also protects those who perform ministerial functions. And what I mean by that are generally these are folks considered plan administrators and not considered fiduciaries under ERISA. And some of those functions would be, determining plan eligibility, preparing employee communications, updating, maintaining participant records, preparing reports, collecting contributions and applying them. So the remittance process of reducing pay and sending contributions to TIA. And then lastly, calculating benefits. So ultimately, the process of determining who's contributing what and when. Next slide. So not all decisions directly involving a plan, even when made by a fiduciary, are subject to ERISA fiduciary rules. So things like business judgment type decisions are commonly called settler functions. And settler functions are generally plan design related, such as establishment of a plan, determination of who a plan will cover, or designing the benefit offerings of a plan. Determination or even amendment of a plan can be considered a settler function. And so what's important to understand is that just like ministerial functions, these types of decisions also have protection within the ERISA framework. So I just wanted to do a quick call out on ministerial functions, settler functions, kind of the distinction between the two, and that ERISA, just like it, provides, direction and guidance for what and who a fiduciary are, it also provides protection for those who aren't. Any questions on these last two slides? Cool. Next slide. This should be slide 7. Who is a named fiduciary? So generally, the plan document designates a named fiduciary, which is really another way of saying the main fiduciary of the plan and the named decision maker, and not typically an advisor or a third party. The named fiduciary would be responsible for selecting, evaluating, and monitoring all other plan fiduciaries and service providers to the plan. So common examples of a named fiduciary: the sponsoring employer, in this case the North Dakota University System, potentially members of the Board of Trustees, a plan committee composed of employees, similar to what you guys are doing here, convening today, or an independent entity, like we talked about, having a retirement plan held in trust. An example of that would be like a bank. So any questions on named fiduciary? Generally, like I said, it is dictated in a document, in a plan document, the governing document of the plan, who the named fiduciary is. Okay, next slide. So starting, here on slide 8, for the next 4 to 5 slides, what we're going to cover are really the fiduciary duties defined by ERISA. And so I'm going to kind of go through them, and if there's anyone, like I said earlier in the call, if there's anyone that folks would feel good about digging into a little bit more, I'm more than happy to stop. So just interrupt me and ask away. So the first is the exclusive benefit rule. A fiduciary is obligated to discharge its duties with respect to a plan solely in the interest of plan participants and beneficiaries. So really what that means is the general, aim, I've used that word before, but the general aim of a fiduciary should always be what's in the best interest of the plan and its participants, and of course beneficiaries of plan participants. There should never be any kind of self-dealing involved, so decisions when it comes to third parties or investment related, that they're not being driven by any kind of exterior influence, or something that would potentially benefit one of the fiduciaries of the plan. So again, just the exclusive benefit rule, the aim should always be the interest of the plan participants and its beneficiaries exclusively. Next slide. Number 2, unless it is prudent not to do so, diversify plan investments to help the risk of loss. So diversification, as most of you may know, is a technique to help reduce overall risk. But as we all know, with investments, there certainly is no guarantee of return of principal or any gains. It's really just a tool that's aimed at reducing risk. So where it's prudent to do so, diversify plan investments to help minimize the risk of loss. And you guys have done a great job with your menu. Normally, you would interface with myself or my colleague Brendan, who I cover the territory with, in an investment review setting where we actually dig into the investment offerings, the performance, the cost, and so on and so forth. And there's a chance that there's a meeting actually maybe coming up on the books where we get to dive in a little bit more and talk about the diversification that's being deployed. And I can certainly say that having looked at the menu, everything looks really good. Number 3, comply with the terms of plan documents to the extent consistent with ERISA. So, those who deal with the day-to-day of the retirement plan and NDUS know exactly how important it is to adhere to the language of the plan document, both from an operational standpoint and a legal standpoint. Fiduciary is liable for duties it takes on, pursuant to not only the division of labor with regard to adherence to plan document, but also the rules governed within. And that shouldn't be any new or groundbreaking information to plan administrators today. There's a reason the plan document is in place. It really is the guidepost for how you actually govern and manage the plan. Next slide. So number 4, prudent person standard. Some of you may have heard this term before, but it's a fiduciary is obligated to act with the care, skill, prudence, and diligence under the circumstances, then prevailing that a prudent person acting in a like capacity in familiar such matters would use. So the prudence test. Let's kind of put that in non-legalese and talk about it in a real world example. So, I think the biggest thing that I would call out here, the decision-making process is far more important than the outcome. And what I mean by that is, as long as you guys are diligent about the process by which decisions are made, and that process is consistent and it's documented, you don't always have to be right. If that's maybe helpful in terms of my explanation. So you can make a decision to put a fund on a watch list. Let's use an example with investment menu. You can put a fund on a watch list because of performance issues. And you may say that, we're going to give that fund 2 to 3 quarters, but that's our, our process. That's within the investment policy statement. And let's say, 2 to 3 quarters passes, that fund still has performance issues, and you guys go ahead and remove that fund and replace it with another. The fund that ultimately is put on the menu can either, exceed expectations or actually be worse off than the fund that was replaced. The point that I'm getting at is that it doesn't necessarily matter that the fund, the replacement fund, is now, performing more poorly than the one before. It's the fact that you guys followed process, is that you guys followed the process of putting a fund on watch list, giving it 2 to 3 quarters, to actually, vet what, the challenges are. And then if you get to a point where a decision has to be made, you make that decision. So, and it doesn't have to always be right. You've taken prudent measures to get to where you need to be. So I'm going to stop there. I want to make sure I've kind of hit the mark on the prudent person standard. This is kind of the biggest one that I get a lot of questions on in terms of what your role is with regard to this particular duty. Any questions here? Okay, great. Next slide, please. Slide 11. We actually do provide a few examples here of procedural prudence. So prudent process for choosing investments, and I actually did cover that just now. Would be risk of loss. So performance, the opportunity for a return. So we're talking about volatility of a particular investment, the diversification. So whether a fund fits into a particular asset class slot, or do we have diversification within the plan? Liquidity isn't really much of a concern, and fees. cost of the investment. So these would be things that, you know, a committee would weigh as part of their prudent process when making an ultimate decision. And again, that decision doesn't always have to be right. It's just about following, documenting a process. Next slide. Five, selection of service providers and the duty to monitor. So fiduciaries must also exercise that same prudence in the selection of any third-party service provider and continue to monitor, you know, the performance of that service provider. So, you know, just staying up to date on anybody that you all are bringing into the plan to help advise and or steer decisions. Just making sure that you're following the exact same process as mentioned before. Just being prudent about the process, the documentation of it, and whether or not a decision actually has to be made. Okay, so next slide. So with that foundation laid, sort of the 5 duties that are you know, governed under ERISA by a fiduciary, let's talk a little bit about the stuff that may keep some up at night, right? So what's at stake for those who act as fiduciaries? You know, there's no denying that some of these look a little scary, right? So it's important to remember the good work that you guys all do, so that none of these really ever become a reality, right? So personal liability, civil action, subject to any kind of penalties, you know, anything that, you know, has to be restored to the plan in the form of a loss from an operational issue, let's say, you know, those can be things that the plan is held accountable for. And like I said, if you're really tuned in with the decision-making process and how you get to a point where a decision is made and have plenty of documentation, like I said, it's not really an issue of whether you're right or wrong. Okay, so it's important to know that the good work you guys do, and I can tell that, you know, the organization here is top quality. You know, prevent these types of things from becoming a reality. Next slide. So how do we minimize risk, right? And maximize participant outcomes? So it all starts with the plan design, right? So if we start with the plan design, then we can ask ourselves, well, what's the purpose of the plan? And how does that then drive what our investment policy statement and the investment menu looks like? Is this plan set out to just accumulate wealth for our participants? Or are we actually, you know, concerned just as equally about income in retirement? And I think your menu today offers a great mix of both, right? You have wealth accumulation vehicles through various mutual funds and annuities, but you also have the ability for folks to get to up to retirement and allow them, you know, to make decisions to get them through retirement without ever having, without ever running out of money, right? Because the 2 biggest risks today in the retirement world, longevity risk, right, which is really people outliving their money, right? So they live longer than what they saved, and they get to a point where they're in their most kind of vulnerable years, and the funds just aren't there anymore to support the needs of life. The second is cognitive risk, right? We all know as we get older, decisions may become more challenged, and so it's important that you guys are diligent in understanding the importance, right, of the lifetime income option, as well as the ability to allow folks to accumulate wealth. So those are kind of the things I wanted to call out here on this side. Any questions? Next slide. So clear processes, you know, the best thing about this material is that I end up repeating myself over and over again because it's sort of how the ERISA framework works. But again, clear processes, documentation, are really, truly critical to protect everybody in connection with the plan, and ultimately will lead to a better participant experience. There's just no way around that, right? So the plan, just as much as you guys need to adhere to the fiduciary duties of ERISA, you can also allocate roles around the table so that there isn't one or a few people kind of taking the burden of all of the duty. So administrative and investment responsibilities are typically two that we see commonly separated. And allocation procedures can be in plan or another governance document. So you can actually call that out in some kind of a plan document. And if allocation duties are done properly, each fiduciary will understand his or her role, his or her potential liability, and ultimately drive better outcomes for the plan, right? Clear, defined rules, clear process, and documentation. If done poorly, right, a fiduciary could be liable for tasks that it's not responsible to perform. So what that's saying is, if fiduciary roles are segmented at NDUS and there are clear, defined roles within the committee, if there is a breach or someone is not sort of pulling their weight, a fiduciary, a named fiduciary, could be liable for the tasks. So again, it's really important to understand who's doing what and make sure process is defined. Next slide. So selecting fiduciaries, right? Getting the process started, and in a lot of ways, you guys have kind of gone through the majority of this exercise here. But just having a selection process that's consistent, that's spelled out with the plan document, get the appropriate people in the appropriate places, leverage the organizational talent. If it makes sense, get faculty involved where there's expertise. And ultimately, really, truly, like I said on the last slide, make sure everybody understands what their role is, and that they're accepting of that role, that they come to the table with the understanding of the weight that is on their shoulders as a part of the committee, as a fiduciary, and deliver. Next slide. So oversight and monitoring. ERISA requires a plan fiduciary to hire an expert if the fiduciary doesn't have the expertise to make a prudent decision or provide an opinion on something. So this is another one of those kind of protection elements for a fiduciary. We talked a little bit about ministerial functions, settler functions. This is sort of another one where I call out from the oversight or monitoring, where if there comes a point, and this can be investment related, this can be plan design related, but if there comes a point where the committee feels that the scope of the ask is out of the realm of their ability to deliver an expert opinion, or make a decision prudently, you have the ability to seek outside support. And that is a covered function of ERISA, right? So fiduciary cannot blindly rely on an expert, which is the second point here, but you absolutely have the ability to reach out and seek counsel on a matter and gain protection for the result of that. So the fiduciary must examine whether the expert's assumption are reasonable, understand the advice that's coming in, and ultimately your decision to decide whether it's reasonable to follow or not. But you gain protection by seeking that outside approval or that outside opinion. Another thing with regard to oversight would be RFP, right? So we at TI fully understand that it is prudent for our clients on a reoccurring basis to go out and look at the marketplace and say, is TI the best record keeper for us, right? So that's a decision that's part of the monitoring of a retirement plan. Okay? Lastly, the fiduciary must recognize potential conflicts among any of its third-party service providers, right? So just like you can leverage third-party advisors, consultants, it's important to understand that there's no self-dealing within those entities as well. So monitoring that aspect of it is also a part of fiduciary oversight. And the last slide, plan controls, okay? And so I would just refer to these as just best practices, right? So best practices, a lot of this stuff is you know, more on the day-to-day side of the plan, but you know, understanding your responsibilities. You can always pull this deck back up, pull up those 5 duties, and make sure that you know, what you're doing is falling within that framework. So again, just understanding the responsibilities, and even just us sitting here today, spending 30 minutes on a deck like this is light years ahead of where a lot of our clients are. So again, I commend the group today for taking the time to understand the roles and responsibilities of a fiduciary. We talked a little bit about, you know, allocation of fiduciary duties. So implementing that crisp allocation of duties. Everybody's, you know, knowing what their responsibilities are. Procedures and practices, again, just define process. Administering the plan in accordance with, you know, the plan document, right? Who's responsible for contribution remittances? Super important. You know, you never want a participant to call up and say, hey, I saw the money come out of my paycheck, but it's not at TIA. You know, what gives? The good news is the Department of Labor has some real vague language on timeliness of contributions. So generally, you know, an institution is covered for you know, a remittance that's late. But again, it's real important to kind of understand, you know, who's responsible, and you know, that activity is timely. Does the plan administrator, excuse me, have a comprehensive annual calendar of required reporting and disclosure? So that refers to things like fee disclosure, you know, QDIA notices, things of that nature. And I know your CSM works diligently to keep you guys in line there. Monitor providers and review investment menu. We talked a little bit about that. There is no consultant, investment consultant that works with NDUS, I believe. So you don't necessarily have to review the provider, but you do, you should, right, on a reoccurring basis, review the investment menu of the plan to make sure that you're providing best-in-class offering to the participants. Consider hiring an investment advisor if you feel like that decision is too burdensome to manage and monitor the menu. Proper insurance coverage, right, bonding requirements. Talk about fee disclosure, so complying with fee disclosure requirements, making sure all plan participants are aware of the fees within the plan. And lastly, plan design, right? So just, you know, being in compliance with the document, with the design of the plan. And a lot of that burden is on TIA's side, to be fair. You know, we interface with your participants all the time, both those working and those in retirement. And we have, you know, our record keeping system is designed to be directly in line with your plan document. So generally speaking, an employee is protected from themselves, if you will, from calling us up or going online and working directly, you know, in a digital channel, from doing something that they're not supposed to. So again, just wanted to call that out as well. And honestly, that wraps up my comments for the fiduciary training. I did want to open up the floor to any thoughts, comments. I know the material can be a little redundant, but ultimately, as I've said probably 3 or 4 times, the good work that you all are doing, that I came on about 30 minutes before my section here, just the way you guys manage these meetings and get everybody involved and have roll call and so on and so forth. I can't commend that enough. Half of the hard work is, you know, maybe even more than that is already being done. And so it's just important to continue to document, have a process in place, and again, does not matter whether decisions made are right, you know, turn out to be right or wrong. It's that you followed process to get to that decision-making process. So I'll stop there. Any thoughts, questions, comments?
Colby, thank you so much for your presentation, and I'll just ask one general question. Are we following best practices with our current committee alignment, current oversight and monitoring to make sure that we're meeting the ERISA fiduciary responsibility that we're required to meet?
Yes, you are.
Okay, thank you. Board members, any questions? Well, thank you again, Colby, as well as Melissa, for joining us today.
Yeah, so happy to be with you guys. Thanks for allowing us to jump on.
You bet. With that, we'll move into. I'm sorry, it was somebody. Oh, yes, that was Melissa. Thank you. Okay, that'll bring us to item number 17 on our agenda, committee reports, and we'll start off with academic and student affairs. If Jill wants to give a brief one, that is just fine today too.
Yes, this will be brief. Thank you, Chair Hacker and members of the board. The Academic and Student Affairs Committee met on September 15th. The board this morning has acted on the approval of several policies presented to the board, 403, 402, and 505. And really appreciate Lisa Johnson's work on that and answering the aligned questions this morning. We also acted on one program termination, Minot State, the foreign language program, and the ASAC committee is the final authority on that excuse me, action item. So it was a very brief meeting. We did have some follow-up conversation as most of our committees are having on COVID and its impact on student behavioral health. Certainly, we are in a position to want to ask, how do we anticipate long-term student and staff impact as a result of the pandemic? So want to reiterate some of the comments today. Person-to-person contact is very important, recognizing that this is also a very challenging time for faculty and staff as they work through multiple learning modalities. Hybrid programs are assisting our students with their technology and or personal social needs as well. So I think we want to continue the conversation, as we hope we will, in our retreat setting regarding how as a board we can support the faculty, staff, and students in this area. And certainly physical and mental health rises to the top of the spectrum of needs. So good conversation, very efficient and quick meeting. So I would be happy to entertain any questions.
Thank you, Member Loiters. And student and faculty and staff mental health are critical. And again, we asked the Chancellor to keep a focus on that and his goals. And it will stay on the radar for one of our major topics for the retreat when we're able to have it. So thank you for the report. That'll bring us to Budget and Finance. Member Mahalik.
Thank you, Chair Hacker. The Budget and Finance Committee met on Tuesday, September 15th. The majority of our information has already been covered in the board consent. We did have a report and an update from Mayville State and Mr. Steve Benson and Dr. Van Horn and their plans on their action plan, as well as an update from Ms. Tammy Dolan regarding the CARES Funding Act. Beyond that, the meeting went well. And I don't know if Tammy has any desire, we want her to update us all on the CARES Funding Act or not, but that was the extent of our meeting.
Thank you, Member Mahalik. Tammy, did you have anything to add?
Chair Hacker, thank you. I didn't have a written report that I gave to the committee, but we did just talk about the most recent legislative authorization for us to receive some funding from the governor. It's called GEAR Act funding. That was just authorized, thankfully, by the budget section last week. And so we'll be proceeding with a grant program to award those monies to the institutions and be moving forward with that very shortly. And so that was really my only update, was that we had just one little new piece of money that was coming our way.
Okay, great. Thank you. Audit committee, Member Nesset.
Thank you, Chair Hacker. I appreciate that. Yes, audit met on September 16th. We did our normal work. We already have approved through consent agenda the audit plan. Two items I just wanted to point out that I thought were pretty important. Our internal audit has built and developed a post-audit survey. So they go back and they send out a survey to 71 individuals. 28 replied to that survey. You know, obviously, we'd like to see more participation in these types of things. This is just, once again, I'm just going to say that internal audit is really, it's a tool and it's a friend of the university system. And I hope that all of our campuses, you know, embrace the work that's done by internal audit, because it's really just a way to help each one of the campuses. Let me point out one other thing. The audit committee received an update on the continuous purchase card review. So P cards are being reviewed on an ongoing basis, and we're doing that across the university system. But of course, NDSU and UND have their own internal audit, and my thanks and the committee's thanks goes out to President Brashani and President Armacost for having their internal auditors work and you know, use this data analytics themselves. So that really helps a lot. I also wanted to point out that Chancellor Hagerott made a big thank you once again to Carol Redmond for her work on the COVID task force. And I want to thank our internal auditors. We have interim co-directors. We did our evaluation, and these two individuals, Krista Lambrecht and Dina Cashman, are doing a great job. And I just want to tell you how much I enjoy working with them. Thank you.
Thank you. I would agree. The team is doing a fantastic job, and hope that I agree with your sentiments. Audit is a tool for campuses and not something that should be feared.
Thank you.
Thank you. That will bring us to Research and Governance Committee. Dr. Ryan. Member Ryan, are you with us? I can see you. We can't hear. We can't see
Excuse
you
me.
technically. Okay, there we go.
I unmuted myself. We had a fun meeting on September 16th. Member Nesset and Member Bai were there, and we really have started something that I think is going to be very beneficial to research within the state and how we will contribute nationally. We heard from Minot State University about what was going on with research through two of their researchers, and it was led by or introduced by Dr. Geller, who's in charge there. It's very fascinating to hear what's going on at Minot, and to realize that even though we have two research universities, we have much, much more going on within the state of North Dakota. We also put into that a discussion from the NDSU Development, Production, and Evaluation of cold hardy grapes that was done by Shauna Foster and contributed to by Rod Ballinger, who is he actually is the co-founder of Bear Creek Winery in Fargo. Now, we did not taste any of the wine, but what we learned was that there are 17 wineries in the state of North Dakota and 32 areas where there's grape production. And North Dakota, something I didn't know, but we're doing a lot of research on cold hardy grapes. So who knows, down the road, we may see that we'll become a very productive state with wine. We moved on then and discussed some of our goals that we want to accomplish over the next year. And the main focus will be to understand research at all the campuses and also the private sector. We had private sector participants within the meeting, people from VPP and also from out west, and it's been very much appreciated. We have our document if people want to review that was presented at our last board meeting, actually at our board meeting at the end of June. So we had Minot present. Next month, we will have a presentation from the Vice Presidents for Research, Dr. Shu at NDSU and Dr. Mihilich at UND, and we will find out more of what's going on with those two campuses. But through the rest of the year, we will pull in the other campuses to try and understand the whole scope of research within the state. And in trying to understand that, I've asked Christy to see if we can develop a data bank so that each one of the presentations can be somewhere within the NDUS system. So if people actually want to go and listen to the presentations, they can do that. And I think this would be a very informative methodology of people understanding what's going on with research. I think the second big point is that we are going to work with the campuses, state businesses, and the legislature to really have research become the third leg of the economic stool or engine of North Dakota, the two other legs of the stool being energy and agriculture. So I think there's great opportunity with UND and NDSU working together that we can really move the state forward. And I want to congratulate NDSU and UND on how we've moved ahead in working together. Kudos to Dr. Shu at NDSU and to Dr. Mihilich at UND. I really think we're ahead of schedule. I had anticipated when we started the research committee a little over a year ago that it might take 2 years to have the two research campuses working together, but quite frankly, they've been working together at least for the last year. So it's great, and I think that in the end, it will benefit the state, our students, and all of the faculty that are involved at the campuses. So thank you to those individuals. And finally, the third thing is that we hope to have a lot of fun at our meetings. So if anyone wants to learn more about what's going on in research on the campuses, look at our agenda and you can jump in and listen to what we're talking about. And with that, I would ask if Member Nesset or Member Bai have any other things they want to bring up from the meeting.
Dr. Ryan, this is Kathy Nesset. You conduct great meetings. I will tell you, when you say that we are ahead of schedule, we were so impressed with Minot State's presentations. Dr. Bashani, Dr. Armacost, and your teams. I thoroughly enjoy this research committee, so thank you very much. And I think it's impacting us system-wide. Thank you.
And thank you. I thought it was a great meeting, and to see how North Dakota institutions are collaborating together to help the state is exciting to me. So thank you.
So finally, to end it, Chair Hacker, so one of our major pushes over this next year will be working on the document that we presented at the end of June, working with VPP and also people out west, GNDA, and Levi Andrus to work and see what can be done through the legislature to promote research as hopefully the third leg of the economic stool for the state of North Dakota. So with that, if there are any questions, I'll be happy to take them.
Thank you, Member Ryan and committee members for the very positive and exciting report. Board members, any questions for any of the committees? Hearing none, we'll move into the Chancellor's report. Chancellor, would you like to present on the four-year presidential evaluations?
Certainly, sir. And I'll move it right along, because I know we're getting on to 3 hours in the meeting here. As you recall, because of COVID, we did a two-step on the presidential evaluations. We provided a very succinct 1 to 2 page letter on key parameters, retention, financial, state, key initiatives, and you renewed their contracts in June. But typically at that time, we would also go through the strategic planning online, which gives you lots of granularity in many projects that they're doing. And so that is what we finished out over the last couple of weeks, was updating SPOL, Strategic Planning Online, which provides metrics and progress. As I said in June, I fully recognize that many things begin to slow down or put on the shelf out of necessity as early as the last weeks of February. So those were attached. The presidents are adapting under extraordinary circumstances. Technically, the closeout of this was, June, but a huge assessment of their abilities is could they restart, and they have. And we now have all the four-year campuses with online undergraduate programs, which we've never had in the history of North Dakota. So some major milestones in adaptation have also been occurring, and you'll hear more about that, in the upcoming year. So those are attached. Barring any questions, I'll then go on to their goals. The goals are, again, affected somewhat by COVID, in that we're in a very dynamic situation. So in consultation with the chair and the vice chair, and be mindful of just so many unknowables, we have the presidents extend 2019 goals and then add a couple key things which are already working on. For example, key things we identified in our COVID addendum we were drafting up in April was basically everything we would need to do to restart. And that early work was absolutely crucial. We convened several task force meetings, the cabinet identified needs, and that laid the foundation for the extraordinary success. And I want to thank Chair Hacker because he closed the deal with the governor in several CARES briefings, but literally tens of millions of dollars, which then were awarded through the governor and then the legislature approved. And that was crucial to restarting. And I can tell you there's some states that there's just an absolute food fight going on, CARES money tied up, and that was not the case. In fact, if anything, we had reporting saying how come the university system was so successful in making the case. But that money was crucial to bringing back the students and faculty and staff in the manner you saw briefed in detail by Dr. Wynn earlier. So we'll press ahead. Again, the goals are mindful that we could have some very turbulent days ahead in the winter flu season. So subject to your questions, that's all I have.
Chancellor, thank you. Board members, any questions for the Chancellor, including presidential evaluations? I would just add that I think it's critical that we take advantage of the technology upgrades we were able to do with some of those, some of the CARES Act funding as we look towards the future. And that goes back to the Chancellor's goals. And I think we have a unique opportunity here. And it really reflects on the positive relationship we not only have with the governor's office, but also with the legislature to showcase, our needs and our vision. And for them to award and work together positively on the CARES Act funding. So great job to all involved, and especially Tammy Dolan and the institution VPs of finance. So thank you all. Board members, any other feedback or questions for the Chancellor on this portion? Otherwise, we'll move to fall enrollment. Okay, hearing none. Dr. Jen Weber.
Hello, are you able to hear me?
Yes, we are.
Very good. Thank you. Yes, I had trouble connecting into the meeting, so I'm on the phone. Thank you, Chairman Hacker and members of the board. I'm going to present a couple of documents to you on the census data. And if Terry can just bring up the first document, it's the one from the agenda that says census count. And as a little background, Monday was our census day. And what that means for the system is basically it's the last day that the students can add courses. And at the end of the day, overnight, we run a history, like what we call a history snapshot. And then that snapshot is what's used in federal reporting. So what you see right now is the official head count and full-time equivalencies and scheduled credit hours for each institution in the system. We were at 98% of where we were at last year. And to put a little context around this, I don't know if you remember pre-pandemic, the couple years prior, a lot of what we heard in the media was that there was going to be a lot of doom and gloom for higher ed because the number of students going towards higher ed was decreasing. And we actually knew that the Minnesota and the North Dakota kids who graduated last year was less than the year before. So we were actually expecting to see a decrease of maybe up to 4%. So to be at 98% is really a good place to be.
Ms. Weber, we couldn't quite hear. What was your expectation?
I'm sorry. The expectation was somewhere around a 4% decrease. So we really expected to be around the 95, 96% level.
Okay, thank you.
Yeah, so this is a case where being down is still good because it's not as much as we thought it was going to be. Terry, can you, well, first I should ask, are there any questions on this particular handout? I do have another one I wanted to share that drills a little bit into the demographics.
And Jen, I have the other one up for you.
Oh, okay, thank you. So this next one, and I apologize for not having this in the agenda, but I was just running this one last night and this morning. But this gives kind of a quick look at a system aggregated data for various demographics. So the census numbers there at the top are the same as what you just saw. On the demographics section of the screen, you can see that the first year students, these are the students who are typically right out of high school. They've never been in college before. That group was down just a small amount, about 1%. Transfer students were down about 7% from last year. And then the high school students, these are the ones that are taking dual credit. We also saw a slight decrease in those as well. On the other side, though, we saw a pretty significant increase in the number of graduate students. We were up 7%. And I did look at this in a little more detail to try and figure out where were these changes at. And you can see we had a 1% increase for North Dakota, 7% Minnesota. International and Canadian was actually up, which was a nice surprise. We didn't know where that was going to be with the pandemic situation. But the majority of those additional graduate students are what we would just classify as out of state. They're not Minnesota students, they're not international or Canadian students, they're from somewhere else in the country. Just this morning, there was a report released by the National Student Clearinghouse, which was an initial look, across the country of what's going on in higher ed. And they reported that what they're seeing is about a 2.5% decrease in the number of undergrads and a 3.9% increase in the number of graduate students. So I think we're seeing the same thing going on across the country, maybe in the not in the same proportions, but at least the same patterns are occurring. The next section there is the attendance pattern. So this is full-time versus part-time. We did have a decrease in the full-time and a slight increase in part-time. If you look at this as what proportion of our students, this does mean that 35% of our students now are part-time students. This is a really interesting demographic too, because we have data in the system going all the way back to 1970. And in 1970, only 10% of our students were part-time. And the line that shows through the years is it's steadily increasing. We're just continually increasing the number of students that are part-time as a whole. And then the last part there is looking at the course delivery modes. So this covers the face-to-face courses, the distance ed courses, and then what we call the hybrid. And the hybrid courses are those courses that have a mixture of both face-to-face and distance ed. And again, you can see where the increases are. The hybrid courses, which is where most of those high flex courses fall into, has increased over 329%, and the synchronous online is up 663%. So that's what I have for you. I'll stand for any questions if there are some.
Yes, thank you. This is helpful data. This is Member Bai. Refresh me, what's the difference between synchronous and asynchronous?
Sure, yes. Synchronous means that both the professor and the student are online at the same time, where asynchronous means they don't have to be. The student can go on and do the work and when the instructor is not online.
Thank you.
Well, board members are thinking, there was a recent report by journalists in North Dakota saying higher ed's not adapting. You look at these numbers on the bottom and it's patently not true. They're being incredibly adaptive, the faculty and the staff and the campuses.
Yeah, I agree with that statement. I have a question as well. I'm wondering if there's any plans to update this data like later on in this semester, because I'm curious to see if more will change and evolve over time. I know with my own classes, I'm thinking I may have to do some shifting in terms of how I offer them, just given attendance patterns and stuff like that. So I'm wondering if you're going to maybe update this at all by the end of the semester and kind of see where things fell in terms of course delivery. That's what I'm thinking of.
The data can certainly be updated if that's what is desired, yes.
I think Jen might have cut out. This is Lisa from the university system. We are monitoring the delivery modes over time. And we do know that campus core technology services has told us that several campuses, even this week, are still transitioning courses to hybrid or high flex as equipment's coming in, getting installed. So yes, it is evolving, and I think somebody had said, before officially capturing these, maybe do it at year end to do some year-to-year comparisons, because they are in transition right now. So that's a good question. Thank you.
Good point.
This is Member Bai. I realized I have another question, which is, so how would interactive video differ from synchronous online?
Okay, can you hear me now?
Yes.
Very good. Yeah, interactive video is a course delivery where it's done via camera. So you have a classroom and students connecting via cameras, and the students often will connect over the camera on their computer. So it's very much like this meeting would be, as opposed to online is on the computer, not necessarily with any video.
Okay, thank you.
Good question. It's a lot of data. It's interesting data to digest as we go through, a very short period time of transition that is happening quickly. So thank you. Any other questions for Dr. Weber or Ms. Johnson? Thank you for your work. With that, we'll move on to item number 23, the strategic plan update by Mr. Rosted.
Thanks, Chair Hacker, members of the board. Chancellor Chris Erickson and I conducted one-on-ones with all the board members here the past few weeks, and there were very good conversations, a lot of discussion, a lot of interest, and we primarily came out with 4 themes that emerged. The first, primarily, the big one was handling the current pandemic. Some of the topics that came up were actually interesting. How is the NDUS working with parents, and particularly single parents that have school-aged children? Are we doing enough for addressing those kinds of disparities? Are we supporting telework wherever possible, and keeping talented people in the system was raised as an important issue. The second theme that kind of came out of the discussion was focused on behavioral health. There's been some talk about it already here this morning, and more work will be done on that. It'll probably be the #1 priority for the system here in the next year or two as we emerge from the pandemic. The third area is academics and research. Issues range from expanding research. What does that look like? How far down into K-12 do kids start having access to dual credit? And the necessity of economic diversification, interested in increased efficiencies were some of the topics within that theme. And then finally, the future of the strategic plan and the fall retreat. The fall retreat was supposed to be this month. It got kicked down the road, but the thought maybe is holding it till spring or skip the year entirely. Do we want to rewrite the strategic plan? And some of that has already been discussed here this morning. And so it seems like the general direction is that we pause on the strategic plan for now and wait until we have a kind of a post-pandemic look at what the world is like and what higher eds look like in North Dakota, and then proceed with a plan from there. So that's in a very short nutshell what was discussed at the one-on-ones, Chair Hacker, and I'll stand for questions.
Thank you, Jerry. Any questions? Hearing none, appreciate the update, and I think the jury is still out on whether we're skipping a year of strategic plan updating and doing as you mentioned, or if we're going to try to find a time. And I think COVID's really going to direct some of that in the near term. So that'll bring us to item number 24, which I believe occurred just yesterday, the joint boards meeting. And we've got Dr. Member Loiters that attended, and I think a couple of other board members, as well as Ms. Johnson. So I'll defer to Member Loiters for an update, and she can rely on Ms. Johnson as much as she would like to.
Thank you, Chair Hacker, members of the board, and Ms. Johnson, feel free to jump in. Just again, annually the joint boards meet, which consist of the Career and Tech Education Board, Education Standards and Practices Bureau, the university system, and the Department of Public Instruction. And really the presentation on September 22nd focused on initiatives, organizational goals, supporting the work that each of these entities is doing at this time, of course, much of which is focused on response to student and staff needs as a result of the pandemic. However, 3 words come to mind, and then I'll turn things over to Lisa or any other board members who would like to comment. What was so refreshing to see again that I think is unique to this state, all boards meeting had a common focus, were very coordinated in their initiatives and efforts to support our students across the state, and that of course creates efficiency in terms of resources. So consolidated focus, coordination, and efficiency. So those are my comments, Chair Hacker, at this time.
Thank you, Lisa. You can chime right in if you'd like.
Yep, I was just going to add that the Chancellor provided an update, as Member Louder said, and as well as Katie Fitzsimmons in our office provided just a summary of the growing behavioral health needs of our students. I know this group has heard of them before. Also encouraging our counselors to refer students to the North Prairie Community Clinic for telemental health services. We have increased our contracts for telemental health counseling, and I can't encourage that enough to do referrals so that students aren't backed up for days or weeks trying to see counselors. Our own board member, former board member Caleb DeShock, summarized how esports actually sort of supports behavioral health needs, and that many campuses are employing esports as a means of helping students feel connected, even through virtual means to their campuses, how they've incorporated cost-effective spaces for competitive events and don't require a large footprint on our campuses. So that was just an example of meeting kind of students where they're at. I summarized our transition to distance ed that Dr. Weber summarized in greater detail for you this afternoon, so I won't elaborate on that. And wanted to conclude by thanking the board members that I caught on the call were board members Stolberg, Bai, and Louders for spending the 3 hours on the joint boards meeting. We appreciate your participation and representation of our campuses and the board.
Thank you, Ms. Johnson. Any other board members that attended want to comment? Feel free.
This is Liz Legursky, and I attended, and I just want to say that I found the information shared so informative and interesting, and it was really exciting to see all of the programs and work being done across the state, and some really excellent opportunities, I think, for shared goals and visions and resources, and so it was a really great experience, and I'm glad that I was able to attend. So,
my apologies. Thank you, Dr. Legursky.
Wonderful. That will bring us to other reports, and we'll start with the Student Association. Member Solberg.
Hello, everyone. So some of the questions I sent out to each of the institutions begin with the overall atmosphere on their campus. There was a lot of positive responses, students enjoying the high flex model, feeling like they can make personal decisions for their health, appreciation for the administration for addressing unique needs of students, and then students being excited to be back on campus, and then some of the more negative sides of the stressors of COVID, but it's kind of lessened as the semester has gone on. And also, I asked the students some of the more effective methods on their campus that they feel like has helped share COVID and campus guidelines. So some of the more effective ones that students thought were having the peer-to-peer mentorship and explanation of reasoning. They found that very productive, as well as providing students with the necessary supplies such as face coverings, hand sanitizers, and then as well as social media campaigns. And then the last question that I sent out was if there were any resources or areas that could benefit from more focus from the board. There was a lot of positive feedback on that. Students, again, enjoy the high flex model, but of course, like I've seen too, technology issues have been sort of an issue with, our increased reliance upon technology. But overall, it was very positive to hear.
Thank you, Member Solberg. And if there's anything that the students feel that this board can do to assist them, we are all ears. Student success continues to be our focal point, and in ensuring we have a positive learning environment for students to succeed is a vital part of that. So we're here to support you guys. We'll move to item number 26, Dr. Legursky on CCF report.
Sure, and actually, I had a question for Erica real quick, which I don't know if she can answer or not, but I know there was like a contest that was going on right at the system level for related to COVID, precautions, and has there been any update on that, or?
Yes, that's a great question. Yes, so we had the institutional level competitions last week, and we got quite a few really fantastic and funny videos, so I'll hopefully be sending those out. But then we're just giving the campuses a couple more days of a grace period because it has been a crazy time in case any students had some videos in the working, but they've been turning out really fun, and I'm excited to see how they look.
Oh, that's great. I'm glad to hear. I'm excited to see them too. So for our CCF update, the CCF did meet on September 15th, and a lot of our discussion, of course, was on updates related to COVID-related issues on the various campuses. Excuse me. And I think one theme that is important that keeps coming up is, the importance of having continued testing and making sure that testing is regular and as frequent as possible in order to stay on top of things, and also easy to access and available at all the campuses. And so we're really grateful for, I think we've seen some progress in the last couple of weeks in terms of plans on various campuses for doing that testing and that continued testing. So I'm glad to see that, and I think the council will be as well. We did discuss a little bit as well some concerns about Measure 1, which will appear on the North Dakota ballot in the spring. And I think though that those concerns have been resolved. There's some concern that that measure could impact the staff and faculty representation on the board, but I think we've worked through that, and I don't think that will be a concern. Other than that, I think I'll just throw in, I know I think the importance of thinking about the impact of the COVID context and all of the things that are happening on faculty mental health and well-being. I kind of just want to throw out there that I think there's been a lot of support for adapting in terms of technology and being able to support for technological innovations and how to offer our classes and how to be nimble in the way we do our classes, and that support has been really excellent and great. I think the next area where I think we need to do some focusing on is really thinking about the importance of mental health support and well-being for just faculty. I think there's some real burnout starting to happen, and we're only in like the 5th week of classes, and so I'm a little bit concerned about just the longevity of faculty's ability to keep going. You know, we started out strong, but so I think if there's things we can do as a board to help support initiatives to support mental health on the campuses, I think that's something that would be really appreciated, you know, not just for students, but for staff and faculty as well. So that's my report from PCF.
Thank you, Dr. Legursky. Any questions, board members?
I would just respond to Dr. Legursky's observation of burnout. That is a concern, and I know Mr. Dosh went quickly through the slides, but one of the efforts we're trying to do is understand lessons and learn as fast as we can, so we don't have to have such broad campus-wide procedures. We can begin to identify risk areas, risk activities, and then be more surgical. Otherwise, we share your concerns of people just tiring out.
Thank you, Chancellor. Staff Senate report. Is Retha still with us?
I sure am. Thank you. So for Staff Senate, our last meeting was September 14th. Business-wise, we did have a few changes. We had a vacancy with one of our positions on the one of the committees, and so we've done the work to fill that. Then I sent out the campus updates. You can browse through those. You'll see a lot of work still going on, as difficult as it is for many of the staff senates on campuses to continue to meet and do some of our normal routines. We've kind of made the best of it. So there were some events for State Employee Recognition Week, which or State Employee Recognition Month, depending on how it was observed. There's been a couple changes in that over the past few years, whether it was a week or a month, but regardless. And then I also wanted to send, and I'm remiss for not having put the URL in the email what I already sent out, so I will follow up with that later, but we did launch a State Staff Senate website. It's staffsenate.ndus.edu. It's another place where you can view the latest campus updates, news, or also contact members of State Staff Senate. So just another way to be accessible to board members or to our constituents across campuses. Our next meeting is going to be October 12th. I also just want to make a couple of comments on things that were highlighted and brought up through the course of this meeting. So really wanted to appreciate first Dr. Louders and then also Dr. Legursky for mentioning the mental health and the workload, especially from my viewpoint of staff. It really has been a stressful time for all of this, and appreciate it constantly or getting the attention and discussion from the board members. It's certainly been a difficult time for everyone. There's nobody excluded from that. Many of the staff members are still working on campus. That does vary a little bit by campus as to how many staff or what percentage of camp are physically present, but some of the work, such as delivering the meals to students who are in quarantine and cleaning the spaces of classrooms and offices, just has to continue to be done in person. Perhaps placing some staff members in certain roles at a increased risk in the middle of a pandemic for their own personal health, but it's also a mental toll just on day in and day out, coming in to know that you're doing your job, and are you safe in that or not. Not to say that campuses haven't been doing everything possible to keep us safe. They seem to have been doing as much as possible, and so appreciate that, but just recognizing that it is an extra workload, or mental workload for a lot of us. We did also discuss some of the on-campus staffing, and it has varied greatly across the institutions. Some seem to be operating with very few people on campus, whereas there were other institutions that have very few people working from home in the staff areas. So there is a little bit of a disparity there, and I know every campus is operating differently and has different priorities, and the community and COVID outbreaks and environments are different for all of us, but just to be mindful of the fact that we are all employees of the university system, and want to make sure that we're giving equal opportunity when it's needed for some of those telework environments to handle on the staff side as well. So with that, I would stand for any questions. Otherwise, turn it back over to you, Chair.
Board members, any questions for Ms. Mattern? Do know that our thoughts and support are with both the staff and faculty through this time. We understand the challenges. Many of us face them in our regular day job lives too. So we know this is a challenging time and appreciate everybody that's stepping up. With that, we hit public comment. And I don't know if maybe Jerry or Darren King are still on the line. I don't believe Microsoft Live is real conducive to public comment. Is there an email that we could send them to for any public comment?
Hacker, actually, there's a Q&A section that Eric Olson should be monitoring. So if there were any questions that came in, that's how he would accommodate that.
Okay. Did we see any public comment at this point? If not, we'll allow that to come in here for a moment as we assess this meeting.
Chair Hacker, there has not been any Q&A submitted.
Okay, thank you. I know these are challenging, board, and I hope please feel free to provide feedback. We're doing our best to connect board members. I know we had a little hiccup today with member Mahalik and member Mattern, and we'll work hard to try to get you guys connected a little better next time. I appreciate the flexibility of the board here to ensure we do get our business done. Any feedback?
Chair Hacker, this is Casey. Any timeline on when we will have an 8th member to the board?
I know my understanding is the applications are open. I don't recall the deadline. It's not coming to mind at the moment. It's likely a few weeks away yet. And then the selection process ensues. My hope is that they will move a little quicker than last time, but we really don't have any control over that.
I know we don't have control over it, but this is one of those things that maybe legislators or whoever is involved in setting up how timelines work should realize that we're in a different era, and we need to, move faster, not slower. And to me, the process seems a bit stretched out, and especially with the difficulty, that we've had in having a member start up and then leave, and it just shows that maybe that timeline should be looked at by those who are in charge of setting the timeline. Just a suggestion. One other suggestion is that I think we had a lot of difficulty at the budget finance meeting with the media and the problems of communicating. And I would suggest, as in the past, that if possible, the meetings just be telephone as opposed to having the audio visual when it's not needed.
Yep, and we'll take that under advisement. I would just encourage each chair, committee chair, to work with Darren King and Jerry in that regard. It really depends on your agenda and what you have ahead of you as a committee regarding whether or not you need presentation style or if a conference call would work just as effective. So,
thank you.
Yep.
Chair Hacker, Member Mahalik here. Before we wrap up, I just wanted to give an update on the CTE Center in Minot and thank Dr. Shirley and Dr. Migler for presenting. We've seen approval come through from the City of Minot as well as their Magic Fund to provide the funding to build a state-of-the-art center, which should be available and ready to roll by fall of 2022 at the latest. So thank you to them for their help.
Thank you for that update, and that is one of our goals is workforce, and CTE is a key component of trying to solve that challenge, and that's very exciting for Minot State and the City of Minot.
Thank you, and Dakota College of Botany, we appreciate that.
I did get a text from Terry Meyer. The deadline for applications to apply for the open vacant board seat right now is November 13th. And just to follow up, Casey, as I mentioned, we don't really have a lot of control, but what we will do is the chancellor and I, maybe offline, we'll see how we can engage with the governor's staff and some of those folks that are on the selection committee.
Well, maybe the other thing to do, and this is my point, this is Casey, is determine who has set up the timelines of the process, whether it's legislated or if it's just been done that way, and just look at the whole thing, because to me, if people want to apply, if you give them 2 weeks time, if they don't know within 2 weeks, then I guess my looking at it is, well, then maybe they're not right for the board. And I think they just need to compress the timelines so that, you know, things can get done in a more timely basis so that we can do our work with the board that we should have. And I think it's unfortunate that we've been left with no additional board members since July 1st. Well, we had one for one meeting, but that person was even appointed late.
Yeah, we've effectively operated with a vacancy for going on 9 months, technically.
Yeah,
quite some time. Yep. Appreciate the feedback, Dr. Ryan. With that, board members, our next meeting is October 29th at 9 a.m. and that is planned for a Teams Live schedule again. We will discuss November and December. I would just add that traditionally the November meeting is canceled, and I would let board members know that the December meeting, I don't plan to cancel that. That sometimes can get canceled, and the reason is, you know, we may have a revenue forecast, and we may need to have discussion on our budget again. As you will recall, we had some discussion on the budget previously, but we want to be responsive, and we'll work with system staff to try to see how that timing will work together. But October 29th, 9 a.m., it'll be a Teams live event again. Thank you. Have a wonderful week.
Thank you.
Thank you, Nick.
Thank you.
Thank you.
Thank you.
For a great meeting.
Many thanks. Have a great day.
Thanks, Nick. Appreciate it.
Thanks all.